Okay, good afternoon, everybody. Welcome. This is our April 15th, 2021 regular City Commission meeting. We're glad that you're all here. With that, Madam Clerk, I'll turn it right over to you. Oh, sorry, we're going to call this meeting to order.
First, we have the adoption of the consent agenda with one modification.
Commissioner Santos.
Thank you, Mr. Mayor. I'd like to move that we adopt the consent agenda with the one modification that's on the screen and then also I'd like for us to pull CA4, that's 201005, the RFP for rental housing efficiency. So the regular agenda.
Okay, motion to adopt the consent agenda with one modification, text file change for 201103, and then pulling, what was it, CA4?
Yeah, to the regular agenda.
Pulling CA4, which is item 201005, and putting it on the regular agenda. All right, Adam, I'll turn it over to you. Or I'm sorry, we have Larry, I think, today.
Mayor, good to see you. There are no commenters on the agenda updates.
Okay, Madam Clerk, back to a roll call vote.
Mayor Poe, who seconded the motion, if I could?
Me.
It was Sacco, Commissioner Sacco.
Thank you. Okay, Commissioner Sacco?
Aye.
Commissioner Ward?
Aye.
Commissioner Ariola?
Yeah.
Aye.
Commissioner Santos?
Aye.
Commissioner Johnson?
Aye.
Commissioner Simmons?
Aye.
Mayor Poe?
Aye, that motion passes unanimously. Next item, please.
Next, we have the adoption of the regular agenda with several modifications. First, file 201098, denouncing discrimination against Asian American communities. There is revised backup. There is an added item, number 201100, Terry Fleming Day. File 200999, there was an added resolution, acceptance of grant funding at Grace Marketplace. This item was added after agenda review. Next, if you can scroll down, file 201058, second budget amendment to the FY 2021 General Government and Financial Operating Plan. This is an added item that was incomplete before publication. File 201103, there's an update on the St. Johns River Water Management District, lake minimum flows and levels. And it was requested that this item come back to the City Commission meeting at GPC. File 201053, the mask mandate, there is additional backup that's been added. And finally, file 201082, Commissioner Ward National Bee City Program. This item has been removed and will be heard at the May 6th meeting.
Okay, thank you very much. And just to remind folks, we do have 3 times certain items. I'm not optimistic that we'll stick to that schedule, but we'll do our best. Commissioner Simmons?
Thank you, Mayor, and that's what I was going to bring up. I do want to move to accept the regular agenda with modifications, but I would also like to see if we can hear one of maybe a resolution prior to the 1:45 time certain. That time certain is something that I brought forward, and we have 40 minutes.
Oh, yeah, absolutely. We will, we'll take up any items that we can. I mean, we can maybe start with the, maybe the advisory board annual report if they're here with us.
Okay.
Or, yeah, we'll keep busy until that time certain item.
Okay.
Absolutely. We'll just kind of play by ear. We'll see what, you know, how many guests we get for public comment.
Okay.
Okay, so there's a motion to adopt the agenda with the modifications that were presented. Is there a second? Seconded by Commissioner Ward. The motion was made by Commissioner Simmons. Ms. Shalley?
Yes, thank you, Mayor. I just wanted to point out that number 6 on here is the same as number 1 that was added to the consent agenda. So basically 6 can be stricken.
Right, okay, yes, thank you. Okay, and our printed agenda that already reflects that, so, we're good to go. Okay, Adam, over to you. Sorry, Larry, over to you.
I'll allow it one more time, Mayor. We do have one caller on the agenda, and that is Nathan Scott. Nathan?
Thank you, Larry. Good afternoon, Mayor, Commissioners, Nathan Scott. So with respect to the adoption of the regular agenda, I have concerns. Again, we're in a virtual environment. You have established rules of procedure. You constantly violate these rules by adding non-time sensitive items that miss the deadline, and then you're packing them into an agenda, much like they're wanting to stack the deck on the Supreme Court now. It's not acceptable. Okay, the public has the opportunity, particularly in a virtual environment, that you continue to maintain, to have timely access to items that are going to be discussed by the City Commission, timely access to review the backup item or backup documents for those related agenda items, and sticking things on the agenda at the last minute, absent emergency, is contradictory to your own established rules of procedure and policy. There's no need for it. Citizens just want transparency, the transparency that you promised us, Mayor Poe. Remember that? When you ran for office, you were all about open government, transparency, government 2.0. You don't post your email. City's not transparent because you put things on the agenda at the last minute, lacking backup, lacking documents that are supposed to be submitted by a time deadline. So I think it's a reasonable request, with all due respect, in the public interest, that these items not be added to the agenda at the last minute. And I think it's a reasonable request. Now, you can summarily dismiss my voice and the voice of other citizens that feel the same way. But again, at the end of the day, you are the ones that caused this problem because you treat citizens differently. The same rules don't apply. You have your own rules, but a different set of rules applies to the citizens and hearing from the public. So you're hearing from the public now.
Troy,
I'm just asking you to follow your own established rules.
It's out in front. I apologize. I did not realize I was unmuted.
Stand by.
That are inappropriate. Thank you.
That was our only caller on that item.
Okay, thank you. These items were not added at the last minute. Our rules do allow for modification to the agenda. And so there's nothing, we try to get everything in as early as we can and on time, but sometimes there are delays for whatever reason, text changes, maybe an additional piece of backup that would be helpful, but we do our best to get those out several days in advance. And we'll always try to do that the best we can. With that, we've got nobody in the chamber, so we'll move to a roll call vote.
Commissioner Ward?
Aye.
Commissioner Ariola?
Aye.
Commissioner Hayes Santos?
Aye.
Commissioner Johnson?
Aye.
Commissioner Simmons?
Aye.
Commissioner Sacco?
Aye.
Mayor Poe?
Aye, that motion passes unanimously. Next item, please.
Which item would you prefer to hear next?
General public comment. So
I'm sorry, my apologies.
Yeah, we
General
start with
public
folks that phoned in and left voicemail recordings, and then we move to people calling in live.
I'm sorry, that's my mistake. We have no recorded general public comments this week.
Okay, then Larry, back to you.
Mayor, if you could just stand by, I want to make sure that the caller that's on the line wants to speak for general public comment. I believe so, but we're just double checking. Disregard, sir. No general public comment.
Okay, thank you very much. So, Madam Clerk, let's take up do we have the representative for the advisory board presentations?
Kristen, do we have the board representative with us yet, or will they be joining later?
I do not believe I have seen him in the meeting. And I also don't see William Johnston or someone from that department here. So I'm unsure if they were
I think
intending
they're
on appearing
expecting to
later.
arrive a little bit later.
Yes.
Okay, Commissioner Santos?
Thank you, Mayor. What about doing the rental one? Can you squeeze it in there, or?
I'm worried about time on that.
Okay.
I'll tell you what, let's take up the resolutions, because honestly, all of these are just being referred to for a future meeting. So I think we could get through those rather quickly. Madam Clerk, if we'll skip to BD6.
Yes, thank you. Item 201080, Commissioner Harvey Ward, resolution condemning, denouncing genocide.
Mr. Ward?
Thank you, Mr. Mayor. Let me get this off my screen here. A neighbor reached out to me a few weeks ago with questions about how we might bring forward a resolution to do what I think makes a lot of sense and condemn genocide. And trying to get to it, I couldn't bring it up exactly on here. No, not that one. Good Lord. I'll be with you in just a second. That's not it either. There we go. I'm not going to read the whole thing. We've got it in backup. We've had it in there. It's a resolution condemning and denouncing genocide, crimes against humanity, and other mass atrocities, affirming the City of Gainesville's duty to educate people about and take action to prevent genocide, crimes against humanity, and other mass atrocities, and complying with the Genocide Convention. And I move that we accept, where are we? Resolution 20180.
Okay, thank you. Is there a second to the motion? Thank you. Second was by Commissioner Sacco, Madam Clerk. For these types of resolutions, I've been talking with the clerk and the city attorney. There's obviously a significant difference between a legally binding and obligated resolution, like say a budget amendment, and a resolution declaring sort of support or opposition to something. And so if y'all are okay with this, I'd like to work with the two of them to develop a separate process for when either us or one of our neighbors or an organization brings something like this forward. It follows a different process. For one, they really are distinctly different, and we shouldn't treat them the same. Two, the attorney's office goes through a pretty exhaustive review of resolutions to make sure that they're legally defensible and the language is all correct. Whereas these are not, they're not legally binding documents. And so for all of these, including one that I put on here, if y'all would be willing to allow me to discuss that process at a future meeting soon, we'll get this done very quickly. We'll bring a rule change. We'll add a new section for resolutions of support or advocacy, maybe we could call it, and then bring all these back for final adoption when we do that. Because I know the one that I have, still needs some amending, and I've gotten some feedback on it from some of the community. So we don't have, I mean, if you want to adopt these now in the present form, that's fine. But I just, it kind of goes to Commissioner Johnson's resolution last night as well. Having just a cleaner process for those, I think, would be beneficial to us and our neighbors. Commissioner Santos?
Thank you, Mayor. I'm actually not able to pull this one up on the backup. It's coming back as unavailable. So I'd prefer if we were able to delay it. But I do agree on I'm glad we're looking at the process and coming up with something different. I do think that it should be one of the commissioners who sponsors it, though, not like a resident. Resident needs to come to one of us, and then we sponsor it. But having our staff review it and then place it on there and having it a different process is a great idea. Thank you, Mayor.
Yeah, thank you. Yeah, absolutely. That was I would need to come through a commissioner. Commissioner Ward?
Thank you, Mr. Mayor. I will pull my motion, or restate the motion perhaps, that we refer resolutions 201080, 201081, and 201082 to a future meeting.
You can do mine too.
Okay, and 201098 to a future meeting, but not too far away.
Yeah.
But by the end of May, let's say.
Okay. Seconder, agree. Okay. And can you include in your motion authorizing me to work with the clerk and attorney to develop a new process and rule amendment?
So let it be written, so let it be done.
Okay. Seconder, okay with that? Okay. Very good. Thank you for your patience and cooperation with that. I just think it will be a much better process once we get this done. All right. So, Madam Clerk, we have a motion on the floor to refer BD6, BD7, BD8, and BD9 to come back at a future meeting, which I will work on to schedule with you, as well as for me to work with the attorney and clerk on a rule amendment to allow for a separate process for resolutions of advocacy, but that are not necessarily legally binding. Any members of the public wish to speak to that? Mr. Shepard?
There's nobody on the line, sir.
Okay, thank you, Larry. Go ahead, Mr. Shepard.
Did he want me to wait?
Nope, you're good.
I just got here. I'm Don Shepard, the People's Representative, and I just got here, so I'm not familiar with what was talked about. But if it has nothing to do with an infrastructure that's going to complicate things for the people, then I vote for it. But it's not, then we need to talk about it in the next meeting. Thank you.
Very good, yeah, thank you, Mr. Shepard. Yeah, I think the purpose of this will be to simplify, not complicate, so you should, I think, be pleased with that. Okay, 120. Mr. Bolarski, could you all do the update on the water issue, the minimum flow? There's Mr. Cunningham. So, Madam Clerk, yeah, go
I'm
ahead.
sorry to interrupt. Do you all need to vote on the previous motion, or is it?
Sure. Let's go ahead and do it. Look, all of you, I'm leaning on staff heavily. We were all here till about 11:30 last night, and so we're all not at peak performance right now. So, Madam Clerk, thank you for catching that. Let's move to a roll call vote.
Thank you. Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Hayes Santos?
Aye.
Commissioner Simmons?
Aye.
Commissioner Ward?
Aye.
Commissioner Sacco?
Aye.
Mayor Poe?
Aye, that motion passes unanimously. Okay, if we could take up the water item next.
Mr. Mayor. And as you lean heavily on staff, I lean heavily on staff in the form of Tony Cunningham here. So even though I have notes as to what that update is, I'll let Mr. Cunningham, since he's been part of this on a regular basis and living and breathing it, I'll let him speak to the issue for you.
Okay, before we go to you, before we go to you, Tony, the attorney would like to get in here.
Yes, Mayor, this is the item that was moved to consent and you all already approved it.
Okay, but I think we were hoping, I'm sorry, I didn't understand that they were two separate or the same thing. The commission did want to, I think, get an update of where we were. So if we can just do that quickly.
Yes, Mr. Mayor, I can do that. So the quick update would be, this is the item we discussed at the GPC meeting last week. That item, sorry about that. After that meeting, one of the things that came out of that meeting was we asked the governing board, the city commission, the mayor wrote a letter to the governing board for St. Johns River Water Management District asking for a delay of the adoption of the MFL rule and the recovery strategy. They chose not to delay that, so they adopted the MFL rule and recovery strategy. So they denied it. Yes, sir.
I think you may have you're talking.
Oh my gosh.
You're talking.
And so I'm sorry, something happened on my computer. So they adopted that rule. We are in the situation where that rule could potentially affect GRU's water withdrawals to serve our community. And we don't think that it is allocated equitably. And so what we did on the consent agenda was basically ask for approval from the city commission in order to do a potential legal challenge of that rule, because it starts, once they adopted it, started a timeline, a 21-day timeline. And so we asked for that approval, which you guys granted through the consent agenda. In addition to that, we are working closely with the Water Management District, hoping to not need to ultimately challenge the rule in order to get to a place where there's an equitable distribution of responsibility to meet that MFL from all water users. And so we're continuing to work with them, but also looking to potentially engage in a legal challenge if we can't come to resolution within the strict timeline. And Nicole can add any to that if she'd like as well.
Yeah, thanks. I mean, that's probably fine, Mr. Cunningham. I think we were just interested in what happens between now and the end of that 21-day period and what next steps are. So we'll just expect some communication from you and the GM as to how that goes either way. And then if there's future action that we need to take, we'll deal with it then.
Absolutely. And we do anticipate at the end, there will be action that will come back to the city commission.
Right on. Okay. Thank you, Mr. Cunningham. There are a couple lights here, so stick around. Commissioner Santos.
Thank you, Mayor. What was the vote? Was it a 7-0 vote, or was it unanimous or not unanimous? Do you know?
Oh, Commissioner Ward might be able to help. He was actually on the call. I wasn't on the call. I think it was unanimous, but Commissioner Ward might be able to help clarify that.
I see he's up next, so thank you.
Commissioner Ward?
Thank you, Mr. Mayor. Commissioner Santos, that was unanimous. And I want to take a moment to commend Mr. Cunningham and Mr. Hutton. Mr. Hutton went down to the meeting and represented us live. The interesting thing about this meeting is that even though it directly affected not only Gainesville, but also all the other water utilities east and north of here surrounding Keystone, the meeting was held in Cocoa, which is, the farthest southern reach of the St. Johns Water Management District. This was done, in my opinion, in a great deal of haste. And what it boils down to is the legislative appropriation for, I think it was $48 million, is not enough for the project that they're trying to do. So in a very short period of time, during the legislative session, my guess is so the legislature doesn't notice, is they're asking for an additional 33 million, I think is the figure, through the utilities here in Northeast Florida, North and East Florida. So Mr. Hutton went down to the meeting live and made a good public comment and was summarily dressed down for mentioning the fact that there might be legal remedies involved. He didn't make any sort of threat. He just said that this is where we are and this is what's possible in front of us. And a former state senator didn't appreciate that. At any rate, I spoke as well, and it was clear that they were not going to do anything different. And this will move forward, and I trust our professionals, and we have some amazing professionals. Mr. Cunningham's department is fantastic. I have no doubt that they will be able to make some headway on this, but it is going to cost us some money, and I'm happy to answer any questions that I can, and Mr. Cunningham can certainly answer better. But I did want to commend them and their staffs for preparing me for comments and for being there. So thank you.
Thank you. Well, let's hope for the best over the next 3 weeks here. Okay, thanks for the update. Ms. Bryant, do we have any of our advisory board members? I think you're good, Tony. We got what we needed. Thank you for being with us. Ms. Bryant, do we have any of our board chairs with us?
I do not believe we do. I do see Cynthia Ramos in here, and so I know it's supposed to be their board, so I didn't know if she wanted to speak to see when they would be available. I'm not sure.
Hi, Mr. Fisher won't be able to join us today, so we'll reschedule his presentation for another day.
Okay, and which board was that?
Pension Review Committee?
Okay.
Yes, the Pension Review Committee was the only one we had scheduled for today. We have the Nature Centers Commission and RTS on the 22nd.
Okay, so can I just get a motion to strike BD5? Second. Okay, motion by Commissioner Ward, seconded by Commissioner Ariola to strike item BD5. That's administrative, so we'll just move to a vote.
Commissioner Ward? Aye. Commissioner Hayes Santos?
Aye.
Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Sacco? Aye. Commissioner Simmons?
Aye.
Mayor Coe?
Aye, that motion passes unanimously. Okay, I think we've sort of extinguished our options here. Commissioner Hayes Santos?
One short one where we, the gun lawsuit, if we can just take action on that.
Is that on our
we can
agenda?
start kind of commission comment, I think. It's not a specific item, but we need to take action. That the lawsuit is moved to the Supreme Court for the gun preemption lawsuit.
Okay, Ms. Shelley, you want to speak on that? I know we got an update from you on that.
Yes, thank you, Mayor. As you all know, the city was participating both as a party, and certain of you commissioners were named individually in the collective litigation that was involving the state's preemption of firearms. And unfortunately, at the appellate level, that court largely overturned the more favorable ruling at the district court level. So now the outside counsel that's been representing all of the parties would like to take this on to the Florida Supreme Court. Of course, it will be up to the Florida Supreme Court whether they want to take the case, but the outside counsel has indicated that they can do so for $900, which we still have those funds budgeted because you previously approved that expenditure. And the question then is just, does the city want to be named in the brief that's filed before the Supreme Court, both as the city, and then each of you that were individually named, which I believe was Mayor Poe, Commissioner Ward, Commissioner Hayes Santos, and I think Commissioner Ariola. whether the four of you wish to remain individually named in that litigation.
Okay, thank you, Ms. Shelley. Commissioner Santos?
Thank you, Mayor. I would move that we continue on with the lawsuit and authorize those funds. And then secondly, I also want to continue being named in it as well. I don't know if that needs to be in the motion or just.
I think you can just let her know, yeah. Commissioner Santos made the motion, Commissioner Ward seconded to authorize the city to continue participating in said lawsuit. Funds have already been budgeted. I too, Ms. Shelley, am interested in keeping my name personally attached to the case. Commissioner Ward, how about you?
Yeah, I already know about it.
Commissioner Ariola?
Yeah,
Okay.
that's why I have.
So all the current names are still interested in staying connected to the case. Commissioner Ariola?
That was why I hit my line.
Okay. All right. There is a motion, so let's go to anybody. First, we'll go to the phones. Larry, anybody wishing to speak on this item?
Yes, Mayor. Nathan Scott is on the line to speak to this item. Nathan?
Yes, thank you, Larry. Good afternoon, Mayor, Commissioners, Nathan Scott. So in case you didn't listen, you lost overwhelmingly at the first DCA. Again, it's discretionary review by the Florida Supreme Court. Me personally, as a taxpayer of Gainesville, you guys should acknowledge you lost, that the probability of prevailing is almost nil at this point, but yet you continue to waste taxpayer money, continuing to, advocate for things that, are just unreasonable. And you're like petulant little children that are defiant to the end. You have no respect for the rule of law, yet you continue to want to expend taxpayer money, staff resources, and continue to, fight to the bitter end. So thank you very much when the Florida Supreme Court does not up on appeal, and it'll come to an end. And then the next time, Mayor Poe, you implement some silly emergency order, or by virtue of the city manager, that preempts lawfully that preempts people that have a concealed weapons permit from lawfully carrying their weapons concealed, and infringes upon that right, then exposes you to legal liability up to, including fines. So do what you will, but I think that it's time the Gainesville City Commission and you, Mayor Poe, need to start having a respect rather than a disdain for the rule of law, because each of you swore an individual oath to uphold the laws of the state of Florida under the Constitution, and none of you follow that. You just thumb your nose at what you like and don't like. And I mean, that's not good governance. It's not good governance at the city level, not good level, and it's certainly not good governance at the national level. We need to stop this nonsense. This fringe politics on both sides is absolutely ridiculous. And you guys exemplify, Commissioner Ward just stating, oh, I went to the water management district and they were just going to vote and wouldn't listen to us. Look in the mirror, commissioners. That's exactly what you do. You don't listen to the public. So how does it feel? Thank you.
Mayor, a second caller has joined us, if you're amenable.
Absolutely.
Caller ending in 7337. You have the floor.
Good evening. Thank you. This is Jacqueline Polk, and I'm calling from the Archer community.
Yeah, Larry, I'm guessing this is not about the lawsuit involving municipalities being able to determine gun laws?
Yes, sir. I believe you're correct. She called just as Mr. Scott was finishing, so we'll try to get her back. Thank you.
Thank you. Okay, we'll go to anybody in the chambers. Ms. Shepard, you wish to speak on this issue?
When it comes to a law of gun, it's a law of gun that man made, and a law of gun is a gun don't kill nobody, man does. That's been proven for centuries, and this is still going on. This is not a city item, as Mr. Scott had presently pointed out to y'all. And I'm pointing out to y'all, this is not something we need to spend money on, our city money, when we got homeless people to deal with, we got housing to deal with. And those two items, I was just at the Thomas Center. Thomas Center is still not open to the public to put people in the houses. So when are we going to address these problems as needed, not as items classified by city commissioners or whomever delegated this agenda, placed upon the agenda? This here shouldn't have been placed on the agenda as far as citizens' behalf go, because our chief of police, Tony Jones, is doing a fabulous job of handling that, and we need to give him more support. That's all I have. Thank you.
Thank you. Okay, back to the commission, Commissioner Ward.
Thank you, Mr. Mayor. For the benefit of anyone watching who may be entirely lost in this, as you could easily be, I want to refer you to Florida Statute 790.33, Field of Regulation of Firearms and Ammunition Preempted. What this essentially does is, as it says, preempt all local authorities, anyone but the Florida legislature, from making any, any rules or ordinances relating to firearms and ammunition. Now, that's one thing to say that. What it also does is any rule or ordinance that we might pass would instantly become null and void. Now, I can even see that, maybe. I don't agree, but I could see it. Beyond that, it is the first, let's see. Any person, county, agency, municipality, district, or other entity that violates the legislature's occupation of the whole field of regulation of firearms and ammunition, as declared in subsection 1, by enacting or causing to be enforced any such local ordinance or administrative rule or regulation impinging upon such exclusive occupation of the field, shall be liable as set forth herein. If any county, city, town, or other local government violates this section, the court shall declare the improper ordinance, regulation, or rule invalid and issue a permanent injunction against the local government prohibiting it from enforcing such ordinance, regulation, or rule. It is no defense that in enacting the ordinance, regulation, or rule, the local government was acting in good faith or upon advice of counsel. If the court determines that a violation was knowing and willful, the court shall assess a civil fine of up to $5,000 against the elected or appointed local government official or officials or administrative agency head under whose jurisdiction the violation occurred. I would strongly recommend folks go take a look at this 790.33. It is not a question of simply preempting. It is a question of going entirely nuclear on any local government who has the temerity to pass anything regarding firearms or ammunition. It is a massive legislative overreach and has been since it was passed earlier at the last decade. I urge people to inform themselves on it and draw your own opinions as we continue to move this through the legal system. Thank you.
Yeah, thank you, Commissioner. And it's not just a fine. You can be removed from office, and even comes with jail time. And more than that, it's the precedent that if the state legislature can remove officials from office or fine or imprison them for doing their job, for doing what the people who elected them want them to do, ask them to do, it is a gross intimidation within the democratic process. And so this is about much more than guns and really taking away the authority that is vested in local elected officials, whether they be on a school board or a county commission or a water management district or a city, from doing their job. And that's what we're fighting for. There's a basic principle of the rights of governance here, and it happens to be fought around the issue of whether a city commission can enact the same rules that the state legislature does at the place where they do business. And that's what's so infuriating. That you can't carry a gun into the Capitol building. And I agree with that. But if we try to do the same thing and set the same standard, we can be removed from office. That's worth fighting for. Having the right to do that. And if a municipality doesn't want to do it, then that's their home rule right. And I would think that every single municipality and local government would support that position. And that is why we have so many co-litigants in this case. It's not the city of Gainesville versus the state of Florida. It's many, many, many local governments, because they know what is at stake and what there is to lose, not just in this one singular area, but in any type of local governance. So with that, Madam Clerk, I'm going to move to a roll call vote.
Commissioner Jesus Santos?
Aye.
Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Sacco?
Aye.
Commissioner Simmons?
Aye.
Commissioner Ward?
Aye.
Mayor Poe?
Aye, that motion passes unanimously. All right, we've just got a couple minutes here till our time's certain, so let's just hang out for a moment. Sure.
Voting on now, can we take in, can I ask, is that giving us the right to carry a firearm once we become a commissioner? Or
Nope, it has
mayor?
nothing to do with any of that. This is about us continuing to participate in a lawsuit that we've been involved in. That's it.
Okay. Thank you, sir.
Yep. Try going to work and teaching a bunch of kids about fiscal policy and foreign policy. VHS. The reel-to-reel movie. Madam Clerk, if you could please introduce the next item.
Next, we have business discussion item 1-200560, Partnership for Mobile Outreach Clinic at the Cornerstone Campus, with the recommendation that the commission hear a presentation and approve finalization of the memorandum of understanding included in the backup to this agenda item, once approved by the city attorney's office as to form and legality.
Okay, thank you. Mr. Feldman, did you want to make any introductory remarks here?
Mayor, I'm going to ask Commissioner Simmons first, and I think she's going to ask Ms. Bowie to take it.
Okay, very good. Commissioner Simmons.
Thank you, Mayor. I'm very excited about this agenda item that we have before us today, and I'm going to hand it off to Assistant City Manager Deborah Boyce to give you more information about it.
Excellent. Ms. Bowie, welcome.
Thank you, Commissioner. We are excited to be at this point. This has been a long time
in the making. As you all know, we've had the Health Equity Access Group meeting for a better part of a year. This is the longest year known to man. And it's given us an opportunity to really bring together a lot of different people across the community who do this work in health. And certainly at the leadership of Commissioner Simmons, to really take on the discussion about health equity and the gaps in our community that we've all known have existed for quite some time. So we're really excited today because while that conversation is continuing and the momentum has really reached sort of a magical point, I'll call it, when you get all of the institutions who can make things happen at the table, who are ready to come and help solve this problem. We have a parallel effort that we think will be really important to the continuance of this conversation. If you all can think back to the mobile bus that became sort of the groundwork for what is now the SWAG brick and mortar clinic, we see this as being just as important in that conversation. So we have special guests with us today to talk about this effort with the mobile bus clinic. And if I could ask Sarah, because a big part of this does include our GTech property. So with that, Sarah, if you'll take it away. Thank you.
Welcome,
Thank you,
Ms. Vidal.
Deborah. Sarah Vidal, GCRA. I just wanted to say that we're so excited to bring this item forward. There's been a lot of work and a lot of conversations and meetings and tours, and just bringing healthcare, the beginning of this, to Southeast Gainesville is really amazing. I'd like to thank Commissioner Simmons for her hard work, of course, Deborah Bowie and Sharice and Dr. Harrell and their whole team, because it's been a lot of work to get to this point. But to be able to park the mobile outreach bus at GTech is going to be a wonderful thing. And I also wanted to mention that in our reinvestment plan, this was one of the core priorities for the East Gainesville community, was to see more healthcare services on the east side. So we look forward to the beginning. And with that, I will hand it off to Dr. Harrell to give a quick presentation about the mobile outreach clinic.
Dr. Harrell, welcome.
Thank you. It's good to be here. Let me see if I can successfully share my screen just to have a quick presentation. All right, there we go. Now if I can get it in presentation mode, there we go. Hopefully people can see that.
Yes.
So, and then let me go back to the beginning. So just to quickly give everybody an idea of what the Mobile Outreach Clinic does, as all the folks who are on this call may not necessarily be aware. So the mobile clinic was started in 2010 as a partnership between the University of Florida College of Medicine and the efforts of Dr. Nancy Hart, and also in concert with Sheriff Sadie Darnell at the time, to try and address some issues that they saw in data related to infant mortality and other markers of health inequities in Southwest Gainesville. And I'll get to that in just a second. But just to briefly give you the lay of the landscape with the mobile clinic. So we are a bus, although we're more than a bus now. We have several brick and mortar partner sites, but you can think of us as a primary care practice. We do provide fairly comprehensive primary care specifically to the medically underserved, and we really target those who are unable to afford health care, namely those who are uninsured or underinsured. But one of the really important things that we do in addition to just traditional primary care is we have a real commitment to helping address barriers of care that arise, especially for underserved patients. And we do this through using what's called a care coordination program. And our care coordination program connects our patients with a lot of the really important community resources that are available, especially for our residents in Alachua County who are underserved, who lack financial resources or proper support. And we assign care coordinators who are individuals, almost like case managers. So when you come to the mobile clinic and you get some primary care, maybe get some medications prescribed, get some screenings done, get a healthcare plan in place. We know that it's challenging sometimes to implement that kind of healthcare plan. And so we have a care coordination program to help walk patients through getting the necessary resources that they need to help put that plan into action. And you can see, many may be aware of the term social determinants of health. It's kind of a hot button term. I think of it as barriers to care, but we really focus on those social determinants, not just the pure primary care of it, but also the social issues going on as well. And this is just, as many of you know, the reason we do this is because there's good data, often most of it from the Robert Wood Johnson Foundation, that shows that ultimate patient outcomes and what we sort of define as good health, really only about 20% of that is explained by traditional healthcare, traditional sort of clinic-based health provision, whereas the other 80% is all of those social issues. So that's why we really think it's important. This is a quick slide showing you that initial data that was used, and this is going to help illustrate the story that I hope we can duplicate out at GTech. So this was data collected both by the University of Florida and the Sheriff's Department showing, again, high teen pregnancy, Medicaid births, and low birth weights that were all concentrated in Southwest Gainesville, and what we now call the SWAG area. And the big issue is most of those patients had Medicaid, and where they needed to get their care was all the way over here at the health department. And that was a 2-hour one-way bus trip. And that was unacceptable in terms of having a good resource available for folks who needed health care to have to do 4 hours just of travel to get that necessary health care, because many of those residents were dependent on public transportation. So that was the genesis of the mobile clinic initially, to just go and park a clinic right in the middle of the neighborhood, right in the middle of this dark blue area. And what grew from that ultimately was the Southwest Health Clinic, which I'm sure all of you are aware of. And that really, the mobile clinic was a catalyst for that, because we drew attention to the needs. We proved that there was a demand for quality health care there, and the county responded by creating this health clinic. And I think it's had a nice success so far, and also in tandem with the SWAG Resource Center, which is right across the street. So you kind of have that 1-2 punch of social resources and then specific healthcare resources right across the street. Another place where the mobile clinic's been involved is out at Grace Marketplace, which I'm sure most people are very familiar with. And Grace Marketplace is a place where obviously you have a lot of residents on that campus who have significant social barriers to achieving good health. And many of them have a lot of chronic diseases and are dealing not only with chronic issues, but acute medical issues. You could probably have somebody from Alachua County Fire Rescue or any other paramedicine service that can attest to the amount of medical emergency calls that are generated or have been generated in the past from Grace Marketplace. So it presented itself as a really great opportunity to locate our services once again to provide care to individuals who oftentimes don't have good access to care. And we started just with having the bus park right there in front of one of their buildings, and we would provide primary care and acute care services to all of the residents at Grace, and also to any other individuals on that side of town who needed health care and didn't have access due to lack of insurance or otherwise. And so we would see a lot of patients, and we would be out there every Friday. And we still are there every Friday. However, as demand grew and as attention was placed on the plight of those individuals in their health care, we've been able to grow on-site services beyond just the mobile unit. There's now a whole Grace Healthcare Service Corps, which has a pharmacy called Grace Pharmacy. We've now renovated some rooms in one of the buildings to function as brick and mortar kind of clinical spaces where we have multiple exam rooms. And not only is primary care being provided there, to individuals through the use of those exam spaces, but there's also a lot of public health activity going on out at Grace Marketplace through partnerships with the Med Reserve Corps. And once again, all of this growth of healthcare and access to this specific population of patients, I think was really catalyzed by the mobile clinic's involvement early on in bringing healthcare there. So here's a picture of Dr. Harvey Rowling, who is testing an individual for COVID-19. This is last year when we were helping coordinate the testing out at Grace Marketplace. And now we're doing vaccination out at Grace Marketplace, which Dr. Rowling and the Med Reserve Corps are helping administer. Here's some other examples of ways we do outreach beyond just our traditional sites of care, where we go on a rotating basis 4 days a week. We've also been out to Micanopy at the Willie Mae Stokes Community Center, where we've helped provide primary care services there. We've done back to school health events. This one was at the library partnership on 16th, where we provided back to school physicals for students that needed to have that done in order to enroll in school, or maybe to be able to join a sports team. This is a Children Beyond Our Borders clinic that we've helped run every year, typically out in Alachua, where we provide care to predominantly Spanish-speaking individuals who are kind of slipped through the traditional healthcare cracks. And we do a big pediatric outreach there, as well as outreach to the parents of those children. You can see this is at Anthem Church next to Tower Road Library, where we're providing clinical support to the Equal Access Clinic in Southwest Gainesville and in an after-hours capacity in the evenings. And this represents a Best You program, which we developed to deliver chronic disease self-management education to individuals in our community within their homes. So we would actually send our health education facilitators to homes and community centers of folks in the community who wanted to learn how to take control of their health care. And we delivered those seminars oftentimes in their home with their families and friends. And we had some great success stories from that. And that's something we're continuing to build on. Hopefully I've proven that, mobile outreach is really flexible. It's very visible when you have a bus painted orange and blue. It's very easy for people to see that healthcare is being delivered there. It's extremely cost effective. Our overhead expenses compared to a traditional brick and mortar clinic are tiny fractions. And it just draws attention, and people love the idea of a mobile clinic, and it just sparks interest and sparks attention. And I think that all of these same things can happen out at GTech as we seek to create a partnership there. We create visibility of healthcare being provided there. It sparks interest in the community in investing more in their health. It just provides access in a place where more access is needed. And it gives us kind of a platform to build off of traditional healthcare services to some of what I think are the more effective healthcare approaches that the future of healthcare is going to be organized around, which are things like community health workers delivering care to people in their homes, delivering care to people at their church or at their community center, and having a presence out at GTech, having the mobile clinic as a partner, I think lays the foundation for that future vision of healthcare, where we're really empowering the community. And I'm really excited to do this in East Gainesville, especially because I know that there's a real hunger and desire to take control of healthcare, that individuals really want to be empowered to transform their communities. And I think this is a wonderful first start. So I will turn it back over to whoever needs to take it from here.
Okay, thank you, Doctor. Ms. Vidal or Ms. Bowie, do you have anything to add?
Sarah does. I'll mute myself.
Thank you so much, Sarah Vidal. Thank you, Dr. Harrell, for that presentation. We do look forward to continuing this relationship and look forward to getting marketing out about when the bus will be arriving and the first kind of event. So there will be more on that to come, but nothing to announce right at this moment. And I'm actually segueing into just a quick thank you presentation to Commissioner Simmons in light of sine die. So I'm going to pull up a quick presentation. Okay, sorry about this, entering full screen. All right, so sine die is today for Commissioner Simmons, and for those of you who don't know, because I had to learn when I came to work for the city, it means without any future date being designated or indefinitely. And that seems kind of funny because I imagine that Commissioner Simmons, after this, will remain very much involved and we'll be seeing a lot of her. So in CRA tradition, I just wanted to take a moment and pause and show appreciation. And we do this for each commissioner because we used to have them seated as the GCRA board. And now we're a city department. So this is your day, Commissioner Simmons. So I wanted to start just by saying a few things about Gigi, if I can. Her community advocacy is what struck me the most when I started working for the CRA 12 years ago. So we were always very involved in the Porter's Block Party and backpack giveaway. I remember afternoons on Friday stuffing backpacks at the CRA office and all of us kind of chipping in to make that event happen, and just how fun and how connected it helped us and our team to feel with the community. And Gigi, you made that happen year after year, and it was always successful and always very meaningful for our GCRA team. Second, we got to know you as a Downtown Redevelopment Advisory Board member. So Commissioner Simmons served in that capacity from 2012 to 2015. She served as a member and as a vice chair and as a chair, and she was chair when she completed that in October of 2015. So it was interesting and wonderful to see her kind of rise from the community advocacy to getting really involved in the board and helping push forward many projects through the advisory board and really support and be an advocate for our projects. Then lastly, we've gotten to work with you as a dedicated city commissioner. And the cool thing about this, I think, is that Commissioner, you got to see projects to fruition that you have become involved in and an advocate for through your community advocacy and as being a board member for the Downtown Redevelopment Advisory Board. So thank you for championing these projects. A lot of the projects that you got to see go through, like Depot Park, were a long time coming and adjacent to the Porter's neighborhood. So you put a lot of blood, sweat, and tears into helping move that forward. So when I tried to think of what to say about Commissioner Simmons, this quote really spoke to me and speaks, I think, to Commissioner Simmons' leadership. So real leadership comes from the quiet nudging. It comes with the realizing the time has come to move beyond waiting to doing. And I think that really exemplifies Gigi's leadership. And I just love this picture of you and your mom. So thank you so much, Commissioner Simmons. We appreciate your support, advocacy, and dedication to the GCRA and the greater Gainesville community on behalf of myself and our entire CRA team. And I think that today's presentation is something that you've worked on for quite a while. And I'm just happy that we're able to bring it to fruition on this day. So thank you so much for this privilege and time to participate.
Thank you, Sarah. So with that, Mr. Mayor and fellow commissioners, we wanted to, we thought it was appropriate. This was a project that Sarah just mentioned that's been a long time coming. Staff felt really strongly that we wanted to just sort of add this as a capstone to really all of the hard work and the legacy that the commissioner leaves behind. So thank you for allowing us the opportunity. And with that, we've concluded the presentation.
All right, Dr. Harrell, Ms. Bowie, Ms. Vidal, thank you so much for bringing that forward. And you're right, what an excellent sort of punctuation mark on amazing advocacy that significantly predates your time as an elected official. And that's really special to put that all together. not everyone gets that opportunity, so it's pretty special that you do. Commissioner Simmons?
So much, Mayor. Sarah and the CRA staff, we've been a family for a long time, and I just want to thank you all so much for your hard work and dedication and your commitment to making sure that our community needs are being met and that the voices are being heard. Today, again, is just another step towards making sure that East Gainesville and all of our citizens have the things that they need, health care, and other things that's going to come our way. And the partnerships and the relationships that we have formed, not only with the CRA, but with Dr. Harrell and UF Health and so many numerous partners. This is a testament to what you strive to do and put out. It does work, it does happen, and it does come true. Deborah Boyd, thank you so much. You have spearheaded these projects. You have worked alongside myself and Sarah and the CRA staff to make sure that whatever we need to get done, it gets done. So this could not happen without the various partnerships and the hard work from the city staff, as well as University of Florida Health, Dr. Harrell and his staff and his team, Sharice, who's on the call. So thank you again. This is just a catalyst to what we are hoping, and we're not hoping, a catalyst to what we know is going to take place in East Gainesville at the Cornerstone and G-Tech area, as we look at making that a healthcare hub and a place to empower our people in this community. And so this is just the first step of many to transform this area. So I'm so grateful and appreciative that I've had the opportunity to work with such great people and wonderful human beings that really want to make sure that they put their all into making sure that their community benefits from the hard work and from the things that are deserving to the people in East Gainesville and Eastern Alachua County. So with that, Mayor, I'd like to move that we approve the finalization of the memorandum of understanding that's included in the backup, and based upon the arrival of the city attorney's office as to the form and legality.
Okay, there's a motion by Commissioner Simmons and seconded by Commissioner Ariola to approve the related MOU. Thank you again for all of your, this took a lot of attention and work over a long period of time. So sometimes if you stick with things, they actually happen. And so we really thank you for that. We'll start off with anybody in the chamber that wishes to comment on the motion. You're fine? Okay. Then Larry, over to you.
No comments, Mayor.
Okay. Then we will move back to the clerk for a roll call vote.
Commissioner Sacco?
Aye.
Commissioner Ward?
Aye.
Commissioner Ariola?
Aye.
Commissioner Hayes Santos?
Aye.
Commissioner Johnson?
Aye.
Commissioner Simmons?
Aye.
Mayor Ko?
Aye, that motion passes unanimously. Congratulations, Commissioner Simmons. Okay, let's take a 5-minute recess, and then we'll come back for our next time certain item at 2:15. We're in recess until 2:15. Okay, welcome back. We'll call the meeting back to order. Madam Clerk, our next item, please.
Next item is BB2, item 201053, mask mandate, with the recommendation that the City Commission discuss and takes action as necessary.
Okay, thank you very much, Mr. Feldman. I want to give us a brief update on the county's action and anything else that you might want to offer.
Thank you. So, Mayor, Commissioners, as you know, when we last talked about this, there was a possibility that the county commission was going to rescind the mask mandate. They have not done that yet. They did publish a new emergency order, which we received yesterday, and I included as backup for today's agenda, where they basically, the only item that they modified of substance was added a provision that says that an individual enforcing the order is not allowed to request evidence of vaccination status of any individual. And that applies to the paragraph in the order that says you don't need to wear masks when you are in a gathering that's composed of people who have been fully vaccinated or other individuals approved by the CDC to gather with fully vaccinated individuals. So the commission asked us to start considering putting in place our own mask mandate if the county commission rescinds theirs. You asked that this item come up for further discussion today and asked me to invite Dr. Michael Lizardo from University Health and Mr. Paul Myers, who is the director of the health department for Alachua County. Both have agreed, and they are here in the meeting today. So today is really just a discussion. I'm not looking for the commission to take any definitive action. As your city attorney pointed out last time, this actually is within my authority under the emergency order. So today I'm just looking for input as we continue to monitor the situation with the county.
Okay, thank you, Mr. Feldman. And one other thing that this is what I gleaned from the article in the Gainesville Sun about the meeting, is that they may reconsider this on May 12th. If that is the case, we will meet again before that on May 6th. And so, you know, I mean, we're able to stay ahead of this, I believe. But I do think it would be very helpful to hear from both Paul Myers and Mike Lizardo. I think just getting their perspective on where we are right now and what we need to do, what we need to continue to do to get to where we all want to be, which is, you know, being able to go where we want and do what we want without any fear of getting somebody sick and they eventually dying or having, you know, lifelong complications from this really dangerous virus. And so I don't know who would like to speak first on the topic. Maybe start with Paul Myers from our county health department. Keep it. We'll go in order of bigness of organization. How about that? So we go from Paul to Mike with UFL. So Paul, how are you doing? I really appreciate you carving out some time to be with us today.
Of course. Thank you, Mr. Mayor, commissioners, and appreciate Manager Feldman for all the support he's provided to the health department during the last, year and a half now. Basically where we are, and I wasn't asked to bring a presentation, so I don't have that whole PowerPoint that everybody's gotten used to with the county. You know, we're doing very well. And I just want to remind everybody the reason why we flattened the curve. We flattened the curve to protect the healthcare system. It did get a little hairy there in January, the post-holiday hangover, as we called it. But since then, the hospitalizations have gone down significantly. We have vaccinated over 82% of our most susceptible population. That's the 65 plus in Alachua County residents. We have vaccinated over 68% of those over the age of 50. But we still have ways to go. You know, we have over the last several weeks our positivity rate has hovered, just below 3% in the county. And that is in an environment of a lot of testing. A lot of that testing is being done by Dr. Lizardo and his team, a lot of the private pharmacies here in town, in addition to the health department. And the median age continues to be those in their 20s and 30s. And that's the population right now that we can take a look at the data and definitively say that's who's mainly responsible right now for spreading COVID-19 in Alachua County. The good news is that that segment of the population does not suffer the severe consequences of this disease. And so, as we continue to vaccinate that population, we expect to see our positivity rates go down. We certainly expect to see our hospitalizations go down, but we're not quite there yet. So I'll just stop right there and see if you all have any more questions for me.
Commissioner Ariola?
No specific. I did have one question, but first I just want to take the opportunity to thank Dr. Lizardo and you, Mr. Myers. Like you said, things got hairy for a little while, but by and large, I've been very, very proud with how Alachua County and Gainesville has stayed together and strong throughout the pandemic. I think the issue now, of course, is how do we take advantage of having the least limited vaccine restrictions we've had since they've gotten rolled out, and we sort of expected that the issue would always be volume of vaccines, and the sort of the unfortunate hiccup with the delays in a couple of the vaccines that have been approved, but have now sort of had that rescinded. But for the most part, really proud with how we're moving about. I think we need to continue to be very assertive in how we reach out to minority populations. I've been in contact with you all about how we can reach more of the Hispanic community. There's a definite need to start getting more vaccinations out there, because it's all going to hinge on that, and particularly, as you mentioned, the young population. Now that they're able to get the vaccine, ramping up those efforts, ramping up that communication as well, is going to be key, because I wasn't there personally for Athletic Director Scott Strickland's announcement that they're expecting full attendance in Ben Hill Griffin Stadium, which right now is a huge effort to vaccine. I think that's a little bit. I think the optics are a little different to be talking about football stadiums while the football stadium is being used for mass vaccination, but it's hopeful, and I want us to be in a place in our community where we can do that confidently with enough vaccines administered, and so I know we're talking about mask mandates right now. Obviously I've spoken to my colleagues every time we've had this, and I've been in full support of maintaining those mandates until we have sufficient evidence to show that the spread of the coronavirus has been muted by both our community effort in slowing spread and by the vaccination efforts. And like you said, we haven't gotten there quite yet, but I'm as optimistic now as I've ever been. So I just want to thank you both for your leadership. I want to thank my colleagues for their leadership, management here and in the county. We've got the fourth quarter, which is where you have to play your best. So let's do it.
All right, thank you, Commissioner. And all the commissioners want to get in here, but I'm going to go to you, Dr. Lizardo, first, in case anybody has any questions for you as well. And again, just thank you for carving out a little bit of time. I know how busy you are every single day, and for you to be able to spend a little bit of it with us is much appreciated.
Thank you very much, Mr. Mayor, and thank you very much, commissioners, for having me. I think we're all really busy these days, aren't we? And it's a big challenge. And I think communicating with the city and with the public is probably the single most important thing that we're doing right now for many reasons. Let me just begin by echoing what Mr. Myers said. Paul and I are in daily and multiple times a day communication about our efforts with regard to vaccination and kind of how we can keep the ball rolling, so to speak. I'm very proud of the collaboration that we've had here, and having collaboration with the city and the county. It's been fantastic. But again, as optimistic as I am, and I share that optimism that everyone's been echoing here, is that there's still some heavy lifting to do. And I share that optimism as far as us being able to start getting the upper hand here, getting back to normal as soon as early summer. I am excited about the idea of full football stadiums in the fall. And I think those are all things that are within our grasp. But we still have some troubling pockets in terms of kind of how we can roll things out. And as excited as I am about the first 40% of the population that we've vaccinated, now we start to kind of get into where we actually, the heavy lifting and the hard work begins now. Making sure that we work through folks that may not think they're at risk, people that are very reasonable but think that the vaccines maybe don't work as well as they really do, or people that don't understand why they need to get vaccinated and still wear masks afterwards. Again, I know we are speaking about masks and the importance of continuing that in this really critical phase right now. But at the end of the day, everything hinges on our ability to continue to vaccinate and have people understand why we're doing that. So much of that hinges on our ability to communicate some of the nuances and some of the not so easy to understand concepts as to why we can be super excited about a vaccine that people can, that are still very, very effective, but yet there's this perception that, well, it doesn't make a difference because I can still maybe get COVID anyway. These are important messages for us to get out as we continue to move things forward. Again, the collaborations here in Alachua County and in Gainesville have been very powerful, and I think our community, if I may be so bold, has got an advantage over our fellow Floridians. We've been able to kind of maximize, and I'm using Paul's words once again, be a force multiplier with the resources we have here, and under his leadership, we've been able to get just, you know, I guess we're closing in 100,000 residents. That's you know, above 40%, doing some quick math, of the eligible 220,000 residents in the state that are sick, in the county that are 16 or older. But again, if we stop here, this drags out for a long time. And that optimism is something that lies in our hands. In other words, we have the control over when this ends, and it has to do with how we can communicate the importance of vaccination, how we can explain that the 20s, 30s, and 40s, those are the age groups that are transmitting this infection. And that is the age group that needs to be vaccinated, just like the vulnerable need to as well. Again, emphasizing the point that 75%, 3/4 of the spread is from people in their 20s, 30s, and 40s who may not think of themselves as vulnerable, but yet we cannot protect those 65 and older, even though we have high rates of vaccination, because there's still a lot that have not been vaccinated, and there's still vulnerable people that go across all age groups. So it's almost like the idea that just having raw sewage being poured into the deep end of the pool and saying, oh, I'm just going to stay in the shallow end because there's nothing over here. Again, infectious diseases don't respect age groups, and they cross over from one to the other. So again, that emphasis of really working with reasonable people, which I think is the majority of people that are in those age groups that may not think of themselves as being vulnerable, really working with them, that part of protecting their community, protecting their loved ones, protecting their family members would be them getting a vaccine as well, not just for their own personal health. So again, I think that masks are important for us to continue, for us to be able to get to the point where we can start squashing this epidemic. Numbers have been going up slowly in many parts of the country, and they've been going up here in Florida as well. We're a little bit better off in Alachua County, but we've plateaued. Our drop that we saw earlier is not continuing. And again, if we just press on with the masks, keep it going for now, it is the fourth quarter, get those vaccines rolling out. In several weeks, probably 2 to 3 weeks, we'll really start to see the benefits of vaccinating people in those younger age groups that are responsible for most of the spread. And then we can start talking about peeling these things back that really, despite a lot of narratives out there, despite a lot of misinformation, disinformation, and just downright kind of off-base ideas, we all want to get rid of these things. We want to get back to normal. We want that sense of community, and we want that sense of safety. That's something that I think we all want, regardless of how we view the pandemic. And that's coming. But again, that's going to depend on our ability to communicate well, to address genuine concerns about the vaccines, genuine concerns about masks, and really move forward in as transparent and an open way as possible, giving people the best information they can so they can make their own informed choice. And I think the majority of people will choose to continue on to get vaccinated, continue with the masks until we get to the point where we can get rid of all of this stuff. So again, very encouraged, but again, it's kind of what I call grounded optimism. Again, we've got to get to that point where we can move and explain to people where things need to go, and then continue to support them with any doubts that they may have. But again, thank you so very much, and I'll be glad to take any questions along with Paul, and we'll go from here.
All right, thank you both. I appreciate the update. Commissioner Hayes-Santos.
Thank you, Mayor, and thank you both for being here. Also want to thank Gainesville Fire Rescue for my first shot, and also Alachua County Health Department and UF I went to the stadium and got my second shot, and that was quite an amazing operation you have there. And it's great to, I know some people went yesterday, you don't even need an appointment. Is that now kind of the standard that you don't need an appointment there, or is that kind of as like changing every day?
No, it's a great question. So what we've decided to do, because we still have so much capacity there, that we have moved to giving people the option to get an appointment. We continue to pull people off the sign-up sheets, but also we're taking walk-ins as well. So we really want to encourage people to be able to do that. And we just want to make it as easy as possible for people to walk in, get vaccinated. We've now got the capacity to register people when they come in. So that's very, very helpful. So if there are folks that want to get them, we'll take them.
That's great to hear. It was just people watching. It was a really easy process. You walk there, go in, go out. I think it was under 30 minutes. I do have a question. So what is our current countywide vaccination rate? How many we've vaccinated so far?
So as of today, it's we've vaccinated close to almost 100,000 people in the county, and upwards of 60,000 people have completed the series.
So what is the percentage rate of that? So that's 30%?
So about 1 in 3 people in Alachua County have received at least 1 dose, and about 1 in 4 have completed the series.
Okay. Where do you both kind of, where do you think we need to be in terms of a vaccination rate to feel like we have it under control and not going to have spread of the virus?
I think from my perspective is that I would say that there is a magic number out there somewhere, but instead of focusing on the number, what I want to see is that we'll get there when the rates start to go down. And I think we'll start to see that at some point. That could happen at 50%, 55%, 60%, or 70%. It's hard to know exactly when that'll happen. Most people's best guess is that because it is a fairly infectious virus, it's probably going to be about 70% or so. But it may be lower, and we may start to, but I think the real evidence of that is going to be watching those curves go down, because I don't want to promise a number, because we may backtrack and say, well, the rates aren't down yet, or we may have the rates dropping faster and we say, oh, we got to keep going. So again, we just got to focus on getting as many people vaccinated as we can, and we'll start to see those rates come down and stay down. But my gut feeling, and not really just gut feeling, but the evidence that's out there, is probably somewhere about 70%.
Okay, and in terms of having the COVID rates, so the percentage of, so like currently today was like 2.9% or something like that, in the 2% range of number of positive tests. So are we looking to have that? Is that what you're looking at, like under 1% or 0.5%? Is that the number that you're using as saying that we kind of have the cases under control? Or is there a different number that's being used?
We've talked some about that. Paul, do you want to share kind of some of our thoughts on kind of where we think that we'll be in a good spot?
Yeah, I think the encouraging thing is that right now, even though we're seeing 30, 40 cases a day, it's in a segment of the population that isn't getting very sick. Of course, the risk to that is that they can spread it to others that can get really sick, even though we have vaccinated, over 82% of those that are most at risk. And so I'm with Dr. Lizardo in terms of not wanting to put a number out there. I mean, we know what our vaccination rates are. What we don't know is how many people have been naturally infected. And so when you add the vaccination, that type of immunity to the natural immunity that comes with infection, it may be much, much lower than the number that we all look at in terms of 70%. So I don't want to put a number on it. We'll know it when we get there. But I just want to remind everybody, the reason why these mitigation strategies were implemented to begin with was to flatten the curve, and we've done that.
Okay, and I guess the question to the rate, when do we think the percentage rate of cases would be kind of somewhat under control? I mean, we've flattened it, but we're still not there, I guess, in terms of having it under control.
So I think the epidemiologic curve will start diving. So more than just flat, it should start going down. And again, I don't want to put a number on it specifically, but I think that if we stay consistently down to single-digit cases per day with similar levels of testing, and that we get our positivity rate below 1% consistently, those are going to be very good signs that we're coming to the sort of end of the pandemic phase. But again, remember, no man is an island to himself, right? Neither is any city. And so we exist in a larger context. So that's going to be important to kind of see that happens, not just in our community, but in others as well. If I may add one thing about the vaccination status, is that an important thing that most people need to realize is that the hospitalization numbers are down, but kind of plateaued. And I cannot claim to have universal access to every hospitalized patient in the county, but when I review the census at UF Health, looking through, there's one thing that all those patients have in common, at least that I've reviewed. All those patients have one thing in common. Those patients that have COVID that are in the hospital have not been immunized. That's an important thing to know. It's just the folks that have been hospitalized that we're seeing at UF Health with COVID have not been immunized, regardless of what age they have. So again, that's an important thing to remember, that these vaccines work really, really well, the things that really, really matter. And it not only does it affect that serious illness, but it really significantly stops the spread. So that's an important point, I think, for folks to really get into the grasp on and just know how well these vaccines have been working.
All right, thank you. And just one last, I mean, to your point, now is the hard part of trying to get the last, not the last rating, but a good portion of the population to get vaccinated. I think, at least for myself, if there's anything that we can do as a city to help make that happen and get out there to try to get people to be vaccinated, I think we are definitely on board. I also believe that we should set this same agenda item for May 6th as well, so that we can be kind of ahead of the curve as well. Thank you.
Yeah, and that's fine. And Madam Clerk, if we'll just label it COVID-19 update, because I think it is more general. And before I get to you, Commissioner Simmons, always going to stand up for my Saints. UF is my first alma mater, but the Santa Fe is who pays me. They today, right now, are having a no appointment vaccination event at the Fine Arts Hall out there. And so if you haven't got your jab yet, go to the beautiful Jackson Sasser Fine Arts Hall at Santa Fe College. You don't need an appointment, and you can get your vaccination. Okay, over to you, Commissioner Simmons.
Go Saints. All right. Thank you so much, Dr. Lozardo and Mr. Myers. You guys have done a wonderful job, and I just want to say thank you. I've worked closely with both of you all in the community. And so the question that I have, if maybe you, Paul, if you can briefly update us on, I know I think, you said 1 in 3 people have been, have had 1 dose, 1 in 4 had both doses. What percentage of that, or how many African Americans in our community, minority population, what have you seen far as a trend in the vaccination process and vaccinations within our community? And I think, Paul, you can answer that the number-wise. And in that group, which is who is getting vaccinated more and who's not getting vaccinated, and what can we do from the city standpoint to go out into the communities to assist you in what you all need done for the members of our community?
Sure. And so just to answer one of those questions first off the top of my head, 60% of the vaccines are going into females. Women are getting this vaccine at a rate higher than men. In terms of minorities, if we just use the number of 100,000 people in Alachua County, I can tell you that about 10,000 of those have filled out the consent form that they are African American, but we have another 20,000 that have put down either unknown or other, or the unknown they leave it blank, or they check other. So there's about 30% that could be minorities, but I know of 10% for sure that are African American.
Thank you. And what about the males?
Well, I guess they're just not as smart as the females, because they're not getting the uptake that the females are, and so we really need to have the women in this county, encourage their male counterparts to get vaccinated. We're all in this together, but that's what the numbers show us. That about 60% of the vaccines are going into females.
Okay, thank you for that, Paul. Dr. Lozardo, what can we do to help you get the information out and work and mobilize in our minority communities?
Yeah, I think, again, some of the messaging is going to be really important. And I think that the Vaccine Access Steering Committee that we've been doing since January, Commissioner Simmons, I think that's going to play an even bigger role now, because I think, like I said, the easy part's kind of wrapping up, right? So getting that first 40% or so worked pretty well. It's that second 40% will work. And I say 40 and 40 because I think there's probably 20% that we're not going to get no matter what we do or say. But I think that other 40% is at play. I hate to sound like I'm writing folks off, but there are groups that are going to be difficult. In terms of the minority groups and kind of reaching out, I think a lot more that recruiting more trusted community members, that has worked like magic for us in both the Hispanic community as well as the African-American community as well. And I think that's the key. So recruiting more trusted community leaders to kind of be part of this process is going to be instrumental, I believe. And then having us kind of dovetail behind what strategies those community leaders think will work best, and following up with that. So it may, mass sites will not work. And despite the fact that we did 21,000 vaccinations last week through the Champions Club, we're continuing our Eastside Church efforts, getting a few hundred at a time, chipping away. But I think we can get more churches in that circle, more civic groups, more community groups throughout our more marginalized populations in terms of health. I think that'll be a really winning strategy for us as well, because eventually the lifespan of these mass sites is going to be limited. And so we're going to break up those large teams of literally hundreds of volunteers and start doing a lot more, taking the vaccine to where people are. And so we'll start trying to move in that direction. So however the city can recruit those trusted community leaders, be it political, religious, social, civic, whatever it might be, that's going to really help us. And like I said, those Friday night vaccine access steering committee calls, I think, are going to increase in importance as we move forward.
Yeah, and I think they're working. I know we're having a vaccine event this Saturday at Church of God by Faith. So you are definitely keeping it within the community and keeping it with the trusted members of the community. And so I just want to make sure that, again, that the messaging is consistent across the board and making sure that we get that information into the communities. And I don't know how you're marketing, and that's going to be critical. It's going to be key. I don't know what further steps that we need to take to make sure that our minority population is getting vaccinated.
Yeah, I think we'll continue those efforts, but I think also there's some things that we're exploring that we'll kind of dive more into. For example, CDC has created what they call their COVID-19 Community Corps. So we're starting to kind of explore that a little bit more to see if that's a good resource for our community, where there are resources available for people in the community to know how to speak with their family members, with other people in their community, so we can just really get a lot of volunteers working within the community, accessing really good information. So again, I think we've got a lot of tools to use in the shed, and we're going to need them. But I think we'll be successful. We'll just continue to kind of press on in all segments of our population.
Okay, thank you. So, Mayor, you're going to put this on May 6th update, and are you all going to talk about the stadium? Is that
it'll just be COVID-19 update, and so kind of keep it open in general, depending on what it is that we need to address.
Okay, thank you, Mayor.
Thank you, Commissioner. Commissioner Ward.
Mr. Mayor, let me get in on the Santa Fe love there too. As a Santa Fe alum, I appreciate both my alma maters, Santa Fe and UF. And I just want to take a brief moment to thank Dr. Lizardo, Mr. Myers, Manager Feldman, and GFR, everybody who has been part of getting us to the point where we are. It's been a haul. It really has. Everybody up here, all our commission colleagues, our county commission colleagues, the school board, public staff across our area. This has been hard, and some folks have really done extra work. And the faces of this in our community really have been Dr. Lizardo, Mr. Myers, and I appreciate all the effort that you've put in. I want you to know that when you send the numbers to Mr. Feldman, he sends them on to us, and that's been very useful to me to be able to share with the community. So thank you for continuing to share those numbers. It matters to people. Very few days go by that somebody doesn't question me on the numbers or thank me for sharing the numbers when they come to me. And if you weren't keeping track and sharing them out, I wouldn't be able to do that. So it does matter to our community that you do that, and I hope you'll continue to do so. Thank you for your hard work, and I hope that we get to a point soon where you can all pat yourselves on the back and take a much deserved vacation. Thank you.
Thank you, Commissioner Sacco.
Right. Oh, thank you both very much for being with us. I understand it's still very much a busy season, year and a half for you. So what I have a concern in vaccination, it speaks to one of those deep pockets, like how do you get to them, is migrant farm workers. And so they are, in my opinion, some of our most essential workers in the county, where they grow the very food we eat. We can shelter in place, but if we don't have food, we're kind of out of luck. A lot of these folks have not been, have not qualified up until the 18 and over group was opened. So they've been moving through, living in cramped quarters and just moving along, and now they're here for the growing season. So for the next couple of months, there will be thousands of farm workers in Alachua County who will come into the city of Gainesville for things like shopping, for food, for leisure, for whatever it might be. They will be coming into the city of Gainesville predominantly. And so my question is, what are we doing to get to those pockets? Are we talking to the growers who sponsor them? Are we working with community partners to get a considerable number of vaccines out to them while they are here? What is our plan of action to reach that community?
Oh, you want to go first?
Yeah, so we've had 4 clinics so far, at least, Commissioner Sacco, and we are working with the Rural Women's Health Network. I hope I got that right. That is an organization that is plugged in to these individuals who are coming through Alachua County, and we go to them. Just like we do with hepatitis A, and just like we do every flu season, we go to them, and this has been well established. And so we provide our spreadsheets to the individuals who are plugged into these communities, and we schedule these clinics and we go out to them. So we are aware of that. If you all remember back to last May, we had an outbreak here in Alachua County that really started the summer spike, where we had 100 people that were tested here by Dr. Lizardo and our team on a Friday evening. It was raining out, but they came and we tested them, and I think it was over 95% were positive. So we completely understand and are sensitive to the disease control impacts that people coming through our community who are essential workers, who are here for a very short time, the impact that they can have in terms of spreading this disease. So to answer your question, yes, we are plugged in with that community and continue to have clinics to vaccinate them. It is unfortunate right now that the Johnson & Johnson vaccine is on pause, because that was a very effective tool for us. It was a one shot and you're done. And hopefully that Johnson & Johnson vaccine will come online. But until then, it's just going to make things a little bit more difficult in terms of working out the logistics to get them that second dose.
And then, so from our perspective, again, working hand in glove with Paul's team, we also are working with community partners. And even though going out to them is ideal, sometimes it doesn't work in terms of there's an opportunity. So we just have learned to be very opportunistic. So we actually, working with one of our community partners, we actually brought in, I think it was close to 200 of the migrant workers to the Champions Club with translators, with everybody plugged in, and we got them started with their series. Again, a lot has been made. I don't want to overstep things here and give misleading information anyway, but we have to bear in mind that the Pfizer and the Moderna vaccines, both of them, are exceptionally effective even after one dose. So again, it's not the end of the world if we only get them one dose. The preference is to get the 2 to complete the series on time and on schedule, as was studied. But getting them vaccinated with at least one dose is a priority. So we're not going to miss a beat with the temporary halt in the use of Johnson & Johnson. Also, I saw that Grant Harrell, my colleague there, was on the call right before I jumped on, and I guess you guys were obviously talking about the mobile outreach clinic. He's actually part of our team now as well, and so he's going to be engaging in a lot of the more outreach, the van, to start using that as another tool that we have to be able to kind of take the vaccine to where people are. So stay tuned. We've got more of that coming, and we're going to continue to develop those capabilities as the mass campaign starts to wind down a little bit.
Thank you. And just to clarify, what would be the number, ballpark it for me, of how many vaccines you've actually doled out in those 4 clinics?
It's in the hundreds. I don't have that number off the top of my head. I can certainly share that with Manager Feldman.
Okay, please do. And my last comment is, I really appreciate that UF at the Champions Club has these open walk-in events. And I double-checked to make sure I was correct in saying this. It's only being, the information is only going out in English at the moment. given that we
We can-
have a
we-
diversity of community and language, to be able to share that easily without the burden of mistranslating something, I think that would be helpful if UF, with all of its talent, can put out either a translation of a couple of major languages or put out multiple advertisements or postings of it. I feel a little shortchanged for my community when things only come out, vital things only come out in English. And it seems to give a priority to English-speaking people.
Yeah, duly noted. You got a very good point there. And as a Spanish speaker, I should have caught that. So we'll get that taken care of, and we'll make sure it goes out in multiple languages. I'll get in touch with our media and communications team and make sure it goes out in other languages as well. So thank you for bringing that up. That's a good point.
Thank you, sirs. Thank you, Mr. Mayor.
All right, thank you. Real quick, one question. What's the latest you're hearing on under 16 and when they might, what conditions they might be able to become eligible for vaccinations?
So what we've done in sort of from a clinical side, we've had some exceptions that we've made from a medical standpoint when they were seen by their physician. In general, that's a very complicated medical kind of issue because they still hasn't been authorized for those younger age groups. However, there's hope on the way. So the first studies that looked at that have been completed, and those are now under review for the FDA and the CDC, trying to decide when and if, but really when these vaccines will be approved for 12 and older, because that was the last group that was looked at. The public information, the public related to the data from those studies, including kids, showed that in children from 12 to 16, there were no serious adverse reactions, and the vaccine was 100% effective in those age groups. So it looked really good in those studies that are now being reviewed. And so final determination could be made sometime as early as late May, but probably sometime in June. So we're really encouraged about the idea that 12 and older may get authorized here in the not too distant future. And Paul, I don't know if you heard something newer than that, or is that kind of latest?
No, I know that they've applied for the emergency use authorization, but I think it's sitting with the FDA right now.
Okay.
I will add, though, that once it becomes available, we have the infrastructure in this town, in this county, to very quickly go through the schools and get this done, as we have for the flu for the last 13, 14 years.
Yeah, absolutely. And it would just be amazing if that happened while school is still in session and, you know, we knew where to find everybody. But anyway, thank you for the update on that. And then just the last suggestion, I actually don't know whether or not there's been any attempt to bring a mobile vaccination operation to the Peaceful Sundays, but that's a lot of people in one place at one time. So we could really make something, you know, exciting out of that event that we know is happening anyway. Commissioner Ariola?
Thank you. Really quick, just this was a conversation I had with Dr. Lizardo when I went to go get my shot. It would be a great idea for the manager and for our other officers if we could coordinate a day to promote vaccination for city employees to walk in and get vaccinated. I just think that kind of messaging for each major employer would be good. They can get on that. Thanks.
Yeah, absolutely. And I'm just going to give my personal thanks. I got my second shot of Moderna 2 days ago. 1 week ago, I was at the health department getting tested. I had symptoms and was really bummed out because I was in between my 2 shots and 2 weeks away from the end of the semester. I ended up being negative, obviously, because I'm here. But I got to experience firsthand the incredible level of service and quality of operation at the health department. You know, both of those reinforced how fortunate I feel to be living in Gainesville and Alachua County and have great partnership and great leadership from the health department and from UF Health. So really appreciate it. So with that, let's go to any members of the public that wish to comment. There's no motion on the floor, but if you have any questions or observations, we'd love to hear them. We'll start in the chambers. And good afternoon, Ms. Blunt.
Hello. I hope Dr. Lazaro or Mr.
Myers.
Blanked on his name, Myers, will have a response to this. I actually have discussed it with Mr. Myers. Rode the bus over here. Even though I'm just a few blocks away, I felt like just taking a look on the bus. So I got on the bus, the free mask dispensers there at the front door. There's a signs that say mask required. After everything's settled, you know, people getting on and off, there were 18 people on the bus, not including the driver, which of course made distancing impossible. And out of that 18, 9, half, were unmasked. Now, one appeared to be a small child, maybe 2 or 3 years old, but the other people had some had the mask, you know, under the nose or under their chin, you know, the same as unmasked. So, you know, and it was one of those buses with the fixed windows. Some of our buses have operable windows. Some of the buses, the operable windows don't move anymore, but some of them have fixed windows. This was a bus with fixed windows. And of course, the doors were open for people to get on and off when it came to the bus stop. So I feel like when the bus was ready to go, with that number of people unmasked on board, was it not a violation of CDC guidelines to close the doors of that bus? In other words, to make it a sealed space with that many people in there, some of them a little close together, and that many unmasked.
Thank you, Mr. Blount. Mr. Shepherd? No, nothing? Okay. Larry, over to you.
Thanks very much, Mayor. We will start with our first speaker, which is Nathan Scott. Nathan? Whoops. Nathan?
Yes, thank you, Larry. Good afternoon, Mayor, Commissioners, Nathan Scott. So I have 4 questions for Mr. Meyer. Mr. Myers previously stated that he does not support a mask mandate, and I want to make sure that I heard that correctly. Second question is Mr. Myers stated that hospitalizations are going down, but we're not there yet. It appears that our regional hospitals currently have 39 COVID patients. So what is the target number to be, quote, there or achieved there? Also, too, I'd like to know the third question, what the false positive rates are, and whether it's reasonable to get a consistent 1% positivity rate with false positives. And then finally, my last question, and I think you alluded to this, but wearing a mask didn't stop you from catching a cold or flu or whatever you had last Thursday. And therefore, it seems that the same science would suggest that wearing a mask isn't going to. Oh, could we get Mr. Meyer to explain that paradox, or Dr. Lozano, as he's on the phone? Thank you.
Thank you. We'll get
So,
those
Mr.
answered.
Mayor, my response would be that.
Hold on, Mr. Myers, hold on. Let's get public comment first, and then we'll come back. I've written these down.
Okay.
We'll come back around to them. Larry, go ahead.
Mayor, we have a caller who has identified himself as Josh. Josh, go ahead.
Yeah, thank you, commissioners, for taking my call and allowing public comment. I just wanted to kind of ask a kind of similar question: that what metric are we looking for to drop the mask mandate? And I wanted to share my opinion that the mask should be voluntary, maybe highly suggested, but voluntary and not mandated. So what metric are we looking for before you feel it's acceptable to drop the mandate, and just share my opposition to a mandate?
And Mayor, those are all our callers.
Okay, thank you. For the target, I think we heard Dr. Lozardo, I know, said, and I think Mr. Myers reinforced this. We'd like to see a single-digit new cases daily and something under a 1% positivity rate, but also kind of left it open. It really depends on what we see in the direction of the numbers and what we're learning. I think it's not just in Latch County, right? It's statewide and nationally. We're going to see vaccination rates and a correlation to drop in community spread. So that was answered. Mr. Myers, I think so that answers the target question. I think it is an interesting question, false positives, and then also there's got to be some consideration of how many people could be positive but are not being tested. I mean, we know the asymptomatic there's a certain population that's asymptomatic and never gets tested. They don't know that they have it unless there's some sort of contact tracing that goes back to them. So that sort of balance between false positives and then people that are positive that we don't know in our numbers because of testing. And finally, I think, Mr. Myers, it was represented that you do not support masks. If you could just clarify that position.
Sure. So let me start with the masks. I think I've been very consistent since this event started in early of 2020, and the Department of Health has been following CDC guidelines. CDC guidelines are recommendations. They are not mandates. And so I think I've been very consistent with that. In terms of the false positives, I'll defer to Dr. Luzardo to talk about, these tests. But again, I don't have that data at the tip of my fingers. I think there's a 10% maybe, Dr. Luzardo. I just don't remember what the PCR is, and in addition to the cycle times that are correlated with that. But in terms of the question about when are we know we're going to be there, I'd like to see our hospitalizations at zero, and I don't know that we'll ever get there. What I see right now is just this consistent festering pool of about a 2 to 3% positivity rate. Until we get the vaccine into the arms of those who are spreading this, I just don't know where that number is ever going to land. And it may be that this is the background. I hope that that's not the case. But until we get a large percentage of the population who is spreading this vaccinated, I don't want to put a number or a metric on this, just like I didn't want to put a number or a metric back in the spring in terms of, when is it time to close down schools? I think that we have opened up our public schools successfully here in Alachua County. I think that we have a lot of metrics to be proud of. We have the lowest pediatric positivity rate in the state of Florida. We have the lowest, or one of the lowest, community transmission rates in the state of Florida, one of the highest testing per capita rates in the state of Florida, and one of the highest vaccination rates in the state of Florida. And that's a lot of hard work that our community has put into this. And so I think that we have a lot to be proud of, but I just don't get the sense that this pandemic is in the rearview mirror right now.
Thanks. Mike, did you want to add anything to that?
Yeah, I sure do. In terms of the false positive rate, I think what really matters is what's called the negative and positive predictive value, right? So for example, if you get a positive test, does that predict that you really truly have the infection? And that's going to depend on what's going on at the same time. And this is where the general public may have a little bit of trouble kind of grasping this concept, but just think of it this way. If we were doing the same PCR test, say in July of 2019, and let's say that test existed and there was zero COVID around in the world, we do that test, and every test that you get back that's positive, it's a false positive because the disease doesn't exist. The incidence is really low. Likewise, hopefully in a few months, when you start getting positives amongst asymptomatics, if there's not a lot of community transmission, you don't have a lot of people in the hospital, you don't have a lot of non-immune people. When you start getting positives, then they're more likely to be a false positive. In other words, your positive predictive value goes way down as the incidence and the population goes down as well. So in other words, but when you have a lot of disease in the community, which we know we have now, it's not going to zero. You're looking at the bigger picture. You're not just looking at one case or two cases. You're looking at what's going on in sort of the environment, right? So we're looking at the population. When that's the case, the false positive rate or the negative or the positive predictive value goes up, the false positive rate goes way down. And so that's something that you have to look at the context, and it's not a static thing. It's not like, oh, the false positive rate is X. No, it just depends on what's going on in the community. In terms of the effectiveness of masks, I do struggle a little bit to think that we're still having these conversations about the effectiveness of masks because our own personal data at UF, our own personal data in Florida, our own experience is that, yeah, masks are not 100% effective, but they're really effective in terms of dropping the infectious rate. We compare those who are contacts with masks and those without. Those without masks are going to be infected 2, 3, 4, 5 times more likely than people that are wearing masks. People that are wearing masks spread very little infection compared to those who are not wearing masks when we go and do the contact investigations. So the evidence is overwhelming both locally and actually what's being published in the medical literature to the point where it would be hard to get a paper published now to talk about the effectiveness of masks in this setting. The other piece is that when you say that it's not effective against the flu or the cold, that's a really hard thing to take, to listen to, in the sense that got to check the data, because right now is that with us wearing masks and almost not universal, but very extensive use of masks globally, there's been no flu pandemic, no flu epidemic at all, really. Look at the number of cases of flu in the state of Florida, around the world and around the country. It's gone down close, I want to say zero, but extremely low, the lowest rates we've ever seen, because you've never had this many people wearing masks trying to protect themselves from COVID. But we just saw exactly how effective the masks have been in terms of protecting against the flu. So this is going to change how we see the flu. No, I don't think we're going to have to be wearing masks every year when it comes to the time of flu. But it just goes to show that flu is transmitted very similarly to COVID, and that masks do have a big impact. So again, I think it's important to keep that in mind. And again, we don't want to be wearing the masks, but it would be foolish for us to deny the effectiveness and the role that they play as we kind of get to the finish line and get this done with already.
Thank you, Dr. Lazar and Mr. Myers. And, I'll just say, as I started noticing I had symptoms, I isolated myself in my house away from my family. I wore a mask everywhere in the house, and the rest of my family did not get the same illness that I did. So, while I was unlucky, and I was really rolling my eyes at myself because I've been practicing such impeccable hygiene for the last 18, 20 months. But nonetheless, my behavior, likely kept the rest of my family healthy. And that, to me, is more valuable than whether I got it or not. Gentlemen, I want to thank you so much for being. What? Oh, were CDC guidelines violated?
Oh, yeah. Go ahead, Paul.
I'm not aware of any CDC guidelines that mandate that people wear masks, period.
Okay, thank you, Mr. Myers. Whether either there's not an answer or they don't have it at their fingertips. But gentlemen, I really appreciate you taking time. This will be on our May 6th agenda. I don't know if you'll be available then or not. If you can, we would certainly love to invite you back. We'll make that time certain as well to make it as accessible as we can for you. In the meantime, keep up the amazing work. Paul, the stats you just listed with where we are compared to the rest of our state are proof that our work has been very important in keeping our community healthy. And at the end of the day, it saved lives. And we are not even talking about the long-term consequences of people who have contracted it, but not been hospitalized or not died, and we'll be learning about that for years to come. So all of those avoided cases are incredibly meaningful to those individuals, and they'll never know who they were, who would have gotten it, but for our actions. So. On behalf of our board and the neighbors here in Gainesville, thank you so much. Please communicate that to all of your, colleagues that have been part of this team. And we're with you to the end, and we're probably more excited than anybody to get past this and get back to celebrating Tom Petty's birthday and the fest and all our normal holiday traditions, and I think that's all within our grasp right now. And of course, football. All right, appreciate it, gentlemen. We will let you go. And Madam Clerk, we'll move on to our next item, which we got pretty close on. I will say, Commission, I did talk with the manager, and he said as close to 3 as possible. We don't have a designation for close to time certain, but I do believe that the colleague that we have to help us with the neighborhood survey will be pleased that they're not in the evening. So Mr. Feldman, I'm sorry, Madam Clerk, if you'll read the next item into the record.
Next, we have business discussion item 3, number 201059, 2021 neighbor survey findings, with the recommendation that the commission hear a presentation from the ETC Institute, the vendor who administered the survey.
All right, excellent. Mr. Feldman.
So thank you, Mayor. Commissioner, so as you know, we perform an annual neighbor survey to sort of benchmark where we're doing. This is one of the documents that will feed into your strategic planning sessions as we move forward. This initiative is run through our Strategic Initiatives Office, which is headed by Bobby Griffith, and this program is administered by Jacqueline Stetson, both who have done a great job on keeping this on track. Today from ETC is Jason Murado, and I'm going to turn it over to Jason to walk you through our results.
Okay, Mr. Murado, thank you and welcome.
Hey, thank you. Can everyone see the screen okay?
We can, thank you.
Okay, great. Well, my name is Jason Murado. I'm the Director of Community Research at ETC Institute. And ETC is a marketing research firm that's based in Olathe, Kansas, which is in the Kansas City area. And the thing we specialize in is conducting community surveys for local governments. And we just finished for the second time conducting a neighbor survey for the city of Gainesville. So today I'm going to go through the results of the survey. Now, the full report is very detailed and very comprehensive. So today I'm going to go through the high-level key findings from the survey. I do have one slide about ETC Institute. I mentioned we're based in the Kansas City area, but we're a national leader in providing market research for local governments. We've been doing this type of work for over 35 years. And in the last 10 years alone, we've conducted surveys in more than 900 communities in 49 states. And that includes a lot of work throughout the state of Florida. So this is really the type of work that we specialize in. This is just a quick rundown of what I'll go through today. I'll go over the purpose and methodology of the survey. What I call the bottom line up front is our main conclusions from the survey. And then I'll go through the major survey findings to show how we came to those conclusions. And I'll be happy to answer any questions as well. So there are several reasons to conduct a survey like this. One is to get an objective assessment of how satisfied Gainesville residents are with major city services, and then also to determine what residents feel are the top priorities for the community. We're also able to measure trends to last year's survey. A lot of the questions we asked on this year's survey were the same as the one we conducted last summer, but there were some new questions added this time as well. And then we're also able to compare your results with other communities across the country. So I mentioned this was the second neighbor survey we've conducted for the city. The survey was administered by a combination of mail and online to randomly selected households throughout the city. And that's our standard methodology for these types of surveys. We accomplished our goal, which was to complete at least 1,000 surveys, including an equal number in each of the 4 city commission districts. And as we were administering the survey, we monitored the demographics of survey respondents to make sure it reflected the actual population of the city. So we made sure we had a good representation by key demographic areas, such as age, race and ethnicity, gender, and geographic location. And the results of the 1,003 completed surveys at the 95% level of confidence has a margin of error of plus or minus 3%. So essentially that means that if we conducted this survey the same way 100 times, 95 times the result would be plus or minus 3% from what we're reporting. So the results, of course, aren't perfect, but really it's a very small margin of error. Here we have a map of the city. The red dots are households that completed a survey, and the dark lines are the boundaries of the 4 city commission districts. So you can see the breakout by district. We had a very good representation throughout the city, and this is very similar to what we had in last year's survey. So here are our main conclusions from the survey. We found that residents have a positive perception of the city. 86% of respondents rated Gainesville as an excellent or a good place to live. And that's compared to only 5% who gave a rating of below average or poor. 79% rated Gainesville as an excellent or good place to raise children. And that's compared to only 6% who gave a rating of below average or poor. Overall, the satisfaction ratings on this year's survey were similar to last year. In a little bit, though, I will point out the areas that had the biggest changes in satisfaction, both positive and negative, compared to last year's survey. And then we also found that overall satisfaction with city services is higher in Gainesville than it is in other communities. And I say that because you rated above the U.S. average in 27 out of the 42 areas that we compared. And there were quite a few areas where your ratings were significantly higher. And we'll look at some of those in more detail in a little bit as well. And then the top overall priorities for the next couple of years are traffic flow on major streets, employment opportunities, and affordable housing. So we'll start off by looking at some general perceptions that residents have of the city. This is the very first question on the survey. And here we're asking residents to rate their perceptions of the city in a number of different ways. The dark blue are ratings of excellent, the light blue is good, the gray is neutral, and we interpret neutral as meeting expectations, so a rating of a 3 on the 5-point scale. And then the pink and red are ratings of below average or poor. So essentially the blue are the positive ratings, the pink and the red are the negative. So obviously the positive far outweighs the negative overall. If you look at the top of this chart, most residents gave positive ratings to the city of Gainesville as a place to live, as a place to raise children, as a place for play and leisure, and as a place to work. Now in this question, we asked respondents about their sense of community and belonging in the city. So if you look at the top of this chart, most respondents feel like they could trust their neighbors. Most say that when they have a problem, they can talk about it with the neighbor. Most also feel like they put time and effort into improving their neighborhood or community. And over 60% say they feel hopeful about the future of their community. Only 15% don't feel that way. And we also asked respondents how likely they are to recommend Gainesville as a place to live. If you look at the blue pieces of the pie, 73% of respondents said they would recommend Gainesville as a place to live. That's compared to only 9% who are not likely to recommend Gainesville. So we also broke the results out by geographic area. So for every question asked on a 5-point scale, we create a map that breaks the results out by city commission district. So the report has over 100 maps in it. I've got just a couple we'll take a look at. This map is for how residents feel about the city of Gainesville as a place to live. And you can see the entire map is blue. In fact, a couple districts are dark blue, which is the highest possible rating. But this tells us that residents in all 4 districts feel good about the city of Gainesville as a place to live. This map shows how residents feel about the city's response to the COVID-19 pandemic. And you can see the entire map is blue, which means that residents throughout the city overall are satisfied with the city's response to the COVID-19 pandemic. So we also took a look at the trends to compare these results versus last year's survey. Overall, the satisfaction ratings are similar to last year. On this slide, I've pointed out the areas that had a significant increase in satisfaction compared to 2020. And by significant I mean an increase of 4% or more in satisfaction. One of the things that stood out to me is these increases cover a wide variety of different types of services. So you have some services related to maintenance, parks and recreation, public safety, customer service. The area that had the biggest increase in satisfaction was how well the city responded to the COVID-19 pandemic. And the results were very positive last time we conducted the survey as well, but they've actually gotten even a little bit better since last year's survey. And then there were a total of 10 areas that had a decrease in satisfaction of 4% or more since last year's survey. A lot of these decreases are related to mobility and transportation, ease of traveling by bicycle, traffic flow, ease of traveling by bus, ease of traveling by foot. And then on this question, this is the one where we asked residents how they feel about the sense of community and belonging in the city. The brown bar are the positive ratings for last year's survey. The blue bar are the positive ratings for this year's survey. So you can see there were a lot of improvements. fact, all 9 areas had an increase in positive responses. 5 areas had a significant increase. So, for example, on last year's survey, 70% of respondents felt like they could trust their neighbors. This year, that number is at 74%. On last year's survey, 58% of respondents felt like when they had a problem, they could talk about it with a neighbor. On this year's survey, that number is at 67%. Last year, 56% felt hopeful about the future of their community. Now that's up to 61%. And if you look towards the bottom, last year, 40% felt like their community has good leaders. This year, that number is up to 44%. So we also found that overall satisfaction with city services is higher engagement than other communities.
Could you pause for a question, Mr. Murato?
Yeah.
Okay.
Yeah, absolutely.
Yeah, thank you, Mayor. Mr. Murato, when was this survey in 2020 given? What part of the year?
It was conducted a little bit later in the year than it was this year. It was throughout May and June.
And the reason I ask that is because of the pandemic, and you used the same questions for both years, correct?
A lot of the questions were the same. You know, these ones where I'm merging the trends were the same. There were some new questions added to this year's survey, though, as well.
Yeah, because I see you had the COVID question in this year's. And I guess what I'm not concerned about, but the question that I have is people thoughts were different, have changed, their living situations change, and so I'm questioning how accurate are the comparisons from year to year because of the participants. I mean, this is something that is totally new. It's from one spectrum, one year, one spectrum to the other. And so I'm just concerned about, you know, the comparison of year to year based on a pandemic year where everything was just so chaotic. And now we're doing a survey pretty much at the end of that spectrum where it's, in some people's eyes, less chaotic. So I'm just having a hard time looking at both of these years in comparison and looking at the outcome. It's just difficult for me to really understand and follow, because reality is we were in a pandemic, and the reality is that, like, for instance, if we look at some of your questions that were asked, and I'm just going to take this, like your top 3, if we go back, I think it was the top 3 concerns was like affordable housing. What were they again?
Oh,
affordable. I know affordable housing was one.
Yeah, so I'll move back to that slide. Yeah, traffic flow, employment opportunities, and affordable housing. There were other high priorities as well, but those are the 3 we've identified as the highest priorities.
Can you tell us what were the other priorities?
We will look at that in more detail in a little bit, but some other ones were the overall cost of living. But we'll get to those slides in just a little bit later in the presentation. Overall, the priorities are similar to last year's survey. Most cities we work with do conduct these surveys on a regular basis, and the results are, there are some changes, but they're fairly consistent over time, which I think adds to the credibility of the survey. Certainly the pandemic makes things very unique that we're going through right now. So we have to take that into consideration when we're reviewing these results. But the last survey was conducted during the pandemic as well, although in a much earlier stage of it.
Right, and that's the point I'm trying to make. It was conducted early on in the pandemic, and I would assume the priorities have drastically changed people's opinion are all over the place. So I'm just concerned about the comparisons because we were in the middle of this was conducted at the height of the pandemic. So that's the only question and comments that I wanted to make.
Sure.
Thank you, Mayor.
Thank you, Commissioner.
Yeah. And the results, overall, there hasn't been a ton of change. I mean, these are the areas with the most significant changes. There was no increase of more than 5%, a lot of 4, 5% increases, a lot of increases of less than that, 1 to 3%. Some areas that had a decrease of between 4 and 8%, but a lot of areas there was very little change from last year's survey. I'm just pointing out here the areas that had the most significant changes, both positive and negative.
Yeah, we have one more question. Okay, yeah.
Sure.
How did you come up with the questions?
We worked with staff to develop the questions. For this year's survey, we started with reviewing last year's survey. It included a lot of the same questions. But then I believe staff worked with different departments to kind of get input and decide what questions we wanted to add, what questions we needed to change. And then our firm, ETC Institute, conducts these types of surveys all over the country. So we also provided staff with some surveys we conducted in other communities, just to give them some ideas of some questions they might want to include.
Okay. Thank you, Mayor.
Sure. All right, please continue.
Okay. So next we're going to get into benchmarking comparisons. For these next few slides, the blue line are Gainesville residents who are either very satisfied or satisfied. The light blue are the satisfaction ratings from residents throughout the state of Florida. And then that brownish, goldish bar are the satisfaction ratings from residents from all across the U.S. And those numbers are based on a national study that ETC conducts with residents all across the country on an annual basis. So this first chart's for perceptions of the city. You can see Gainesville residents gave higher ratings than residents in other communities when it comes to the city as a place to live, as a place to raise children, and as a place to work. If you look towards the bottom of this chart, 52% of Gainesville residents feel like the city's moving in the right direction. The regional and national average is a little below 50%, so that's actually a good number for this question. And then 50% of Gainesville residents are satisfied with the overall value of city services compared to the tax dollars that they pay. And that's 6% above both the regional and national average. Here are comparisons for public safety. So your ratings are higher than other communities when it comes to the overall quality of fire rescue as well as police protection. Also, your ratings are higher when it comes to how quickly police respond to emergencies and fire rescue's community involvement and education services. The ratings are a little bit lower when it comes to overall efforts to prevent crime. It's not too much below the regional and national average. And this 56% satisfaction rating is a 3% increase compared to last year's survey. And when it comes to maintenance, there are several areas where your ratings are on par with other communities. A few areas that are lower, such as street lighting, neighborhood sidewalks, residential and commercial property maintenance issues. Now, those are also a couple of areas that had an increase in satisfaction compared to last year. The residential and commercial property maintenance, so at least they're headed in the right direction. For parks, recreation, and cultural services in all 5 areas, your ratings are significantly higher than other communities. This includes walking and biking trails, outdoor athletic fields, youth and adult recreation programs, and then the ease of registering for programs. And then for customer service, there were a couple of areas that really stood out. 83% of respondents were satisfied with how well city employees are courteous and professional. You can see that significantly higher than the regional and national average. 64% of respondents feel like they were able to get their question or concern resolved. And you can see that's also significantly higher than the ratings for other communities. So now we'll take a look at top community priorities. So this is something we call the important satisfaction rating. And this analysis is based on two different types of data. First, we ask residents how satisfied they are with various services, which is primarily the type of data we've been looking at so far. And then the follow-up question is which of these services are the most important for the city to emphasize for the next couple of years. So the idea behind this is that those areas that have a combination of a low satisfaction rating, but at the same time are rated as the most important, should be the highest overall priorities. Making improvements in those areas will have an impact on the greatest number of people. So this first chart's for the quality of life in Gainesville. The top overall priority is the availability of employment opportunities. Out of these 23 items, that's the one that residents rated as the most important, and it rated 21 out of 23rd when it comes to satisfaction from this list. The other highest priorities were the overall cost of living and availability of mental health care.
Mr. Morado, before you go any further, we have a question from Commissioner Hayes Santos.
Sure.
Thank you, Mayor. What's the formula for the important satisfaction rating?
The formula is listed in the report, the actual mathematical formula for how this is calculated.
Thank you.
That's fine. Thank you, Ms. Morado.
Yeah, yep, it's listed in there. So when it comes to mobility, the top priority by a pretty wide margin was traffic flow on major streets. That was by far the area from this list that residents rated as the most important. Other high priority items were how easy it is to find public parking, how easy it is for residents with disabilities to commute, and then other areas that were high priorities, but not as high as those top three, were the ease of travel by bus and by bicycle. This table is for maintenance. The highest priorities here were maintenance of neighborhood streets, the availability of sidewalks, the overall cleanliness of streets, and then street lighting.
Okay, if you'll pause for another question, Mr. Morado, Commissioner Simmons.
Thank you, Mayor.
Sure.
If you go back to the mobility slide, very high
Sure.
priority, how easy is it to find public parking? So are you saying that the respondents are saying it's easy to find public parking? It's easy to find public parking? 38% thought. So just explain that to me.
Sure. Well, there's two aspects to this. This column here that says satisfaction percent, that's the percent of residents who are either very satisfied or satisfied with each item. So 31% are either very satisfied or satisfied with how easy it is to find public parking. And that ranks 6th out of these 8 items that are on this table. The second part is we ask respondents how important, which of these are the most important. 38% rated public parking as one of the most important areas from this list for city leaders to focus on. So the reason it came out as a high priority is it was rated as the second most important item from this list, and it ranked near the bottom in satisfaction, 6th out of 8.
Thank you.
Sure. So we looked at maintenance. For parks and recreation, the top overall priority was city recreation programs. Second highest priority was the availability of walking and biking trails. So on this question, we asked residents to rate the, I'm sorry, it's a moment. On this question, we asked residents which action plan items should receive the highest priority from city leaders over the next couple of years. And you can see the one rated as the most important was affordable housing. The dark red represents the first choice, meaning that's the area that residents think should be the highest priority. The orangish bar is their second choice, second highest priority. Green is third, purple is fourth, and blue is fifth. And we've sorted these based on some of their top 5 choices. So the top overall priority is affordable housing, not just when you sum up the top 5 choices, but if you look at this red bar, which is their number 1 choice. By far, that was the item that the most respondents rated as the most important priority. Second highest priority was homelessness. Other high priorities include creating a development plan for East Gainesville, racial equity, and police standards. And then here we asked which priorities residents feel should receive the most emphasis from city leaders over the next couple of years. And you can see the highest priorities were equitable access to basic needs, equitable access to housing, equitable access to quality health care, and then providing living wages. So we've got one more section to take a look at. These are just some other general findings. So we asked respondents to rate the satisfaction with how well different levels of government have responded to the COVID-19 pandemic. So if you look at this top row, 69% of Gainesville residents are satisfied with how well the city of Gainesville has responded to the COVID-19 pandemic. And you can see in other communities, only about 38% are satisfied with how well their city has responded to the pandemic. And this is based on a national study that ETC Institute's been conducting on COVID ever since this all started last March. We also asked how well different levels of government prepare for natural disasters and other emergency situations. So you can see in this top row that most residents feel like the city of Gainesville is prepared for natural disasters and other emergency situations. Only a very small percent feel like the city's not prepared. And then we asked respondents how confident they are that they would be treated with courtesy and respect by the Gainesville Police Department. And you can see the results are very positive. 84% are either very or somewhat confident they would be treated with courtesy and respect by the police department, compared to only 16% who are not confident. So just a quick recap. We found that residents have a positive perception of the city. Really, there's a lot of examples of that, but in particular, when you look at how many residents are satisfied with the city as a place to live, as a place to raise children. Overall, the satisfaction ratings are similar to what they were last year, but we looked at those areas that have had the biggest changes in satisfaction. Overall, satisfaction with city services is higher in Gainesville than it is in other communities. And the top overall priorities, based on some of those charts we just took a look at, were traffic flow on major streets, employment opportunities, and affordable housing. So that is everything that I had. Does anyone have any other questions or comments?
Not right now. You were very thorough. I appreciate that. There are some things that I think I expected and some things that were pleasant surprises, and then some things that seem to contradict one another. But that's, I think, the nature of these surveys. But overall, this is very helpful information. And I think, as the city manager said, very important as we go into our strategic planning session to make sure that we're focusing on the priorities that our community identifies as, you know, top of list for them as well. So Mr. Murata, I really appreciate your participation and guidance through this whole process. Mr. Feldman, is there anything you wanted to add?
No, sir. I think Jason did a great job on summarizing it. There's a lot more detail in the attachments that are with the agenda, and again, this will be one of the bedrock documents that we use for strategic planning for the future.
Excellent. Thank you. Okay, let's go to any members of the public that wish to make any comments. We'll start here in the chamber. Mr. Shepard.
I'm the people's representative. My name's Donald Shepard, and I didn't hear anything about infrastructure. What are we doing as far as planning towards repairing our infrastructure of our city? The news people and the politicians have been asking, how are we going to look to the future of the infrastructure of the city of Gainesville? There's been mentions about the cable company and how they have been rated, but I'm not hearing that in this here. Itemized documents, which I think should have been done by them. I thank them, first of all, by doing this. This here gives me an outlook of what we need to do in the next 5 years. So this is a very in-depth, itemized list of stuff that we could look over and take direction from towards running our city, towards asking fellow partners and business people how that takes and affects our city. And so I was going to ask you, Mayor, if there's a copy here in chambers, or can we get a copy of this PDF? Because we can't get into the chambers to ask for it because it's closed down, the building's closed down. Can we get a copy of this meeting today and the copy of what he has presented to y'all, to the commission and mayor?
Sure, Mr. Shepherd. We will print you out a copy of this presentation and get it before the end of the meeting tonight. Or do you plan on staying for the rest of the meeting?
Yes, sir.
Yeah, we'll get you a copy of the presentation, absolutely.
Thank you, sir.
Yeah, of course. Okay, Larry, over to you.
Mayor, we don't have any speakers on this item.
Okay, thank you. Back to the commission, Commissioner Santos.
Thank you, Mayor, and thank you for the survey. I hope we continue using it. I think it's a great tool. I also think I'm going to have an annexation discussion, I think, in a couple months too, but I think it's something to consider, surveying those areas that we're considering annexing in the future too, to figure out what do they care about and what are their needs, so we can kind of tailor the message. Or if everything is perfect, maybe they don't need to be annexed in. But that's something for us to consider as well in the future. Thank you, Mayor.
Yeah, thank you. Just a lot of good news in there, and obviously some guidance on some things we need to work on and pay a little closer attention to. But I was really, thank you, Commissioner. I appreciate that. So, Marie, we got a copy for Mr. Shepherd. If you are listening, we do not need to print out another copy.
Thank you.
Commissioner Simmons gave him hers. But anyway, yeah, of course. Thank you, Commissioner Simmons. But anyway, yeah, I agree. This is a really valuable tool. At some point, Mr. Feldman, I'd like to maybe sit down with you and another small group to disaggregate this data a little bit and get a better understanding of some of the subsets. That's the conversation we've been having recently, and overall data is great, but really drilling down into specific demographics or geographical areas is also important. And so, for me, everything is sort of pre or post May 3rd, because that's when I'm done teaching for the semester. So sometime after May 3rd, if we can get a small team together and look a little bit more closely, I would very much appreciate that. Commissioner Santos?
Sorry for another question. Does the data get broken down? I see it gets broken down into district or city district. Does it get broken down into, or is it possible down into the precinct, election precincts, which kind of more correlates with neighborhoods and seeing how the questions and stuff change based on the neighborhood? Is that something that's available, or?
How deeply can we drill down into the data?
We can drill down very deep with the data. We started with breaking the results out by commission district, but right now we're working on a lot of additional crosstabs which break the results out by a lot of demographic questions such as age, race and ethnicity, gender. But we can really break the results down in a lot of different ways, certainly more detailed even than city commission district. If you get too specific, then you're worried about the sample size being too small, so you have to consider that as well. But there are a lot of different ways we can drill down into the data.
Excellent.
And Mayor, if I could add too, one of the features of this survey with ETC is they do create a web portal for all the data, and we still have that out there for last year's data. We will augment it with this year's data. as well that allows any of our neighbors, any interested parties to go online, do their own cross tabulations and deep dives into all the data that's out there. And so that tool is pretty powerful, and I would encourage everybody to go out now, look at last year's data, and start playing around with it while we load up this year's data.
Thank you. Is that found through OpenGNV?
There's a link somewhere on our webpage.
Have you seen our webpage?
Yes. Yeah. So yes. It's
that
on
would
our
rate low,
open
Mr.
data.
Feldman. I know we all know this. I'm not saying anything we don't already know.
So as the commission knows, we're doing a revamp of our website
Yes,
as well.
absolutely.
But yes, this is on our open data page.
Okay, very good. Thank you. That's what I figured. All right, Mr. Murado, really appreciate it. And we'll look forward to kind of getting into some of the details a little bit more here, but really want to thank you for being with us today.
Absolutely. Yeah, thanks a lot. Thanks, everyone.
All right, you stay healthy. And Madam Clerk, our next item, please.
The next item, I believe, is business discussion item 4, item 201022, the water and wastewater rate structure modifications.
Okay, thank you.
With a recommendation that the City Commission direct the City Attorney to draft required ordinance language to implement the recommended rate structure modifications, direct the clerk to advertise later this year along with other rate modifications for an anticipated October 1st, 2021 implementation date. Thank you.
All right, thank you. Mr. Cunningham, welcome.
Well, good afternoon, Mr. Mayor, Commissioners. My name is Tony Cunningham. I'm the Water Wastewater Officer at GRU. Appreciate the time. So this afternoon, the topic of adjusting water and wastewater rate structures. So one of the responsibilities of the water and wastewater systems is to be good stewards of our community resources to provide high quality water and wastewater service in a sustainable manner. And so as part of that, we often look at our rate structures, how they're set up to make sure we are doing that and meeting all the goals for our community. And so I'm going to talk a little bit about some recommendations of ways to improve those structures to meet those goals. And so I am going to share my screen. All right. Can you all see that? Well, no.
Nope. There we go.
All right. Very good. Very good. So let me see. All right. I'm struggling here.
You're in good company.
All right. For some reason, it's not advancing. Let's see. Well, okay. Y'all can see that?
Yes.
All right. So it went. All right. All right. So this afternoon, the goals again of doing this are 1, to simplify the rate structure. And when I say that is to make it more understandable from a customer standpoint. 2 is consistency with other utilities. So, we always look at best practices in the utility space, and we try to, be consistent with those best practices as best we can. 3, direction of the City Commission and for our long-term water supply is to always promote water conservation in our community, and specifically in North Florida. As we look at the future, we need to continue to use less water per person to have a sustainable water supply. And so rates that will promote that. And then finally, lastly, is financial sustainability. So we need to have rates that continue to support that desire of high quality water and wastewater service in our community. So I'm going to hit just real high level some of the water rate changes, and then I'll go into a little more detail. The first one is to adjust the 3rd tier of our water system down so that it's greater than 12,000 gallons would become the cutoff for the 3rd tier. It's currently greater than 16,000 gallons. And so the first one would be to adjust that down. Second one is we have a few wholesale customers in the city of Alachua. Frankly, we've gotten a little behind on updating their water rate. And so this is making an adjustment to a more cost of service water rate of $2.67 per 1,000 gallons. We provide them wholesale water, so we don't manage all of their water distribution system, but we do sell them wholesale water. And then the third water change modification would be the second tier of our water rates. What we attempt to do is to make that a cost of service tier. And the cost of service is now $3.87. And so we'd be adjusting from $3.77 to $3.87 for that second tier. It also, from a simplification standpoint, that is consistent with our general service rate or our commercial rate of what that charge is. And so it kind of brings consistency to those rates. So I'm going to talk a little more detail here about each one of those. So the first one is the tier bringing the third tier down. So if you all can see my cursor, what we have here is our first tier of water, which is from 0 to 4,000 gallons a month, is $2.47. We receive about 58% of our revenue from that tier. The second tier is $3.77, and it goes from 5,000 gallons up to 16,000. And then the third tier is $6.04, and it's greater than 16. The recommendation at this point is to bring that third tier down to 12. And what the goal of this really is primarily driven by water conservation. And so it brings the price signal for getting into that third tier, it brings it down to a lower level, which then is going to encourage customers to utilize less water. The vast majority of the time, if a household, and this is residential, if a household is getting into this greater than 12,000 gallons, most likely it's more considered a discretionary use of water. So more like outdoor use, like washing a car or watering the lawn. And that use of water would be in that third tier, whereas typical indoor use would fall less than that 12,000 gallons. The other thing I do want to show on this table is the $3.87. So again, that other modification of changing that second tier to match the cost of service and the general service rate. So these changes, they'll improve the financial stability a little bit for long term. They promote water conservation. As I said, the primary driver is that price signal. They support the long-term water supply. So one of the things we talked about earlier today, and we will continue to be talking about in the months and frankly the rest of my career, is going to be long-term water supply in North Florida, and making sure that we're protecting the resource, we're protecting the natural systems, but we're also providing a water supply to our community for now and into the future. And water conservation just continuing to be a primary tenet of that approach. The last part of that is there is some risk of wells being installed, but we think that risk is low with this adjustment. The other two adjustments, as I stated earlier, one is the City of Alachua water rate. So currently their wholesale rate is $1.62. We have a contractual relationship with them where we're able to increase our rate, and we at this point want to make that pretty significant a step toward that. And so our recommendation is to go to the $2.67. Overall, in terms of revenue for GRU, it's not a lot of revenue. Like I said, there's only 4 wholesale customers there. But from an equitability standpoint, in terms of our water rates for all of our customers, we think it's important to bring it up and then make that adjustment. And then the last one, as I touched on a couple times, is adjusting that second tier from 377 to 387 to meet that cost of service. I can pause for a second if anybody has any questions, because I'm going to transition to wastewater. Are there any questions, clarifications?
Yes, Commissioner Simmons.
Mayor, you just stated you only had 4 wholesale customers.
For City of Alachua, we have 4 meters that we connect our system to that are in the City of Alachua. Those meters serve multiple customers on the other side, but it's only 4 connections.
Okay, thank you.
All right.
So from a wastewater standpoint, which includes the reclaimed water system as well, there's 3 adjustments that are recommended. The first one is adjust a commercial wastewater. Currently has a 95% multiplier, and to make that 100%. So the best practice in the utility industry is to be 100% of the water use. Oh, so let me step back. So wastewater is not metered. And so it's a little more challenging to charge for wastewater. And so what we do is we utilize your water use and your water bill to estimate what you're returning to our wastewater system and then charge wastewater accordingly. And so historically in the commercial system, the 95% multiplier was really to acknowledge some other uses that didn't return to our system. The vast majority of our commercial customers typically return most of their water use returns to the wastewater system, because if they do have outdoor use, they typically have a commercial irrigation meter, which measures that. And so because of that, by charging the 95%, we're essentially not charging for all of that wastewater that's returning. And again, with the industry practice being the 100%, we're recommending to make that adjustment for those commercial customers, general service customers, adjusting from 95% multiplier to 100. Winter max. So there's folks that understand and know winter max, and then there's folks that don't. So winter max is a calculation we utilize to basically during the winter months, look at your water use during those months, and that water use establishes a cap on wastewater charge all year long. And so what we're recommending, so that is not an industry best practice. Most utilities do not do that. And what we're recommending is moving toward a more best practice in the industry, which is really to charge wastewater based on your water use all year, like month by month, but then to have a cap of 12,000 gallons. And if you go above 12,000 gallons on water, then you no longer are charged for wastewater above that. You're charged whatever water you use, but you're no longer charged for wastewater. And so we're recommending that adjustment, and I'll talk a little more detail of that in a second. And then the third one is reclaimed water. So reclaimed water currently is $1 per 1,000 gallons. We only have about 1,500 connections to reclaimed water. They're really around our Kanapaha water reclamation facility. We're recommending adjusting that from $1 to $1.23.5. And what we're trying to do is move that towards indexed to our potable, our first tier potable rate, which is $2.47. And so that puts us at 50% of that rate. And so that is the recommendation for that reclaimed water rate. So I'm going to go a little more detail on each of these, although I kind of did this one quite a bit. By adjusting that commercial rate, we think we're more accurately representing that wastewater and bringing it into consistent practice with other utilities. And then it is improving financial stability from a revenue standpoint. And then, yeah, like I said, it's more representative of actual use for those customers. So winter max, making that adjustment, the wastewater and doing the cap, it will do a couple of things in addition to consistency with other systems. It also simplifies the billing for people that don't really understand winter max. Now, I think it is going to be somewhat challenging for people that understand winter max and have practiced that over the years. And in fact, I wanted to share when we presented to the UAB, there was quite a bit of feedback, particularly from the CWC weatherization folks, that they've spent a lot of time educating a lot of our customers on winter max, and they had a concern that it's hard to unwind all that education. And so I recognize that. We have been working on a communication plan on how to communicate to our customers and educate them if we moved in this direction and made this adjustment. And so we would do that. But I do want to acknowledge, I think it will be confusing for some of those customers although this will still be, you'll still have a lot of control on your bill because it'll really be linked to your water use. And to reduce your bill, you would reduce your water use and you would reduce both your water and your wastewater bill. And then ultimately there would be a cap of 12,000 that once you exceeded that, you would not get charged for wastewater beyond that. And because of that link, it also is going to continue to have a strong price signal to promote water conservation as we move forward. And then the reclaim rate is pretty straightforward of what I shared before. The other thing I will share, and one of the reasons we're talking about making this adjustment really is from the long-term water supply discussion and the water management districts in the state of Florida, is a continued movement as a utility toward a more water conservation rate that both covers the cost of service, but also sends a price signal to customers so that the reclaimed water is looked at as an important commodity and something that we need to preserve and conserve going forward. And so I think we're going to be on a march of increasing that rate to demonstrate that and to move toward cost of service and to promote the long-term water supply. So that's really that's the recommendation that I'm bringing forth, is these 6 things to implement. And I can come back to this slide because it's a good summary slide, but I will, the ultimate recommendation is that City Commission direct the city attorney to draft a required ordinance language to implement the recommended rate structure modifications, and then to direct the clerk to advertise later this year, along with other rate modifications for anticipated October 1st implementation date. So we will have budget season later where we'll be talking more about long-term needs and all in the system. We really wanted to try to get this rate structure modified so that it can then inform that discussion during budget season. And so the idea would be if we get approval and moving this forward, that'll help be able to set the discussion this summer, but we won't implement these actual changes until we do any other changes in rates, which would be October 1st, the beginning of the fiscal year.
Okay, thank you, Mr. Cunningham. And maybe if you want to go back one slide, just to leave that up for everyone to look at, and we'll turn to Commissioner Santos.
Thank you, Mayor. I think these are good changes. For the winter max, I think while some people do understand it, I think the vast majority of people in our community have no idea how it works. So I think this will make things much easier. I'd like to move staff's recommendation.
Okay, is there a second? Okay, motion by Commissioner Santos, seconded by Commissioner Ariola to adopt the staff recommendation. I agree on the winter max, and I kind of was thinking about this after I talked with staff. If people are still being really frugal during those winter months, they're no worse off for it, nor is our system worse off for it. So it's not going to disadvantage anybody. But it's, it's like I understand it and know about it, and then I forget to do anything differently at that time anyway. I'm, somebody that's quite familiar with it. So, yeah, I agree. I mean, I think these are all, simple modifications that really bring the utility more in line with industry standards. And I did have a conversation about that, second tier ending lower than 12. I firmly believe that any irrigation should pay a premium. We really, it's not in anybody's best interest to irrigate. And the county has consistently had incentive programs to get people to put in Florida-friendly landscaping. But I think that their advice at this point was, let's see what happens with this and see how behavior modifies with this, and then after a couple years we can see if there's cause to lower that a little bit lower to maybe 10 or 8 or something like that. So that was the only kind of question I had. But we did look, and average use for a household with 4 people is 7 kgal. So that's your shower and laundry and doing the dishes and that sort of thing. So even if you went to 10, that's some wiggle room for extra people or whatever. So giving the dog a bath. But anyway, I'm supportive of the recommendation for today. Commissioner Simmons?
Mayor, how did you come up with the proposed wholesale price? How did you come up with the extra, what,
Yes.
$1.05? Is that standard? Tell me a little bit more about that.
Yeah, definitely, Commissioner, Mr. Mayor. So what we did was, like I said, the current rate's $1.62. It's quite a bit lower. What we did was really looked at what their rate is for their customers. So their second tier rate or their general service rate is actually $2.67. And so in this initial move of adjusting, kind of a big adjustment, we moved to what their actual second tier rate is. And then I think moving forward, there need to be adjustments in the future, but that was like the first, based upon their current rate structure and being consistent with that.
Okay, thank you.
Okay, thank you. We have a motion on the floor. Anybody in the chambers wish to make any comments? Mr. Shepherd?
Yes, my name's Donald Shepherd. I'm People's Representative, and I don't see where we would need to improve the infrastructure rates on the water, and most of all, the water, wastewater, is not being metered. But yet, we had a city commission meeting here, and we took and talked about how much the farmers are getting charged for water running down the ditches and water that they're using to water their fields, and they're going out of businesses because of these prices. Now we want to bring up more prices on them and our citizens. This year, we should be talking over this, and I'd like to know when the next URB more meeting is, because I'd like to be there to bring up these factors and be in support of the people, as I am choosing to call myself the people's representative. I think that October 1st is too far away. It is according to the budget, yes. And how we're gonna work this into the budget. I'm very excited about seeing how this is gonna happen. I don't see how the budget is gonna get met. We're not gonna be able to meet the budget according to this here quota that has been put before you. More weight put upon our mayor's shoulders and our commission's shoulders of how to take a budget. The budget. We are going to have to cut programs to make this happen. This is what got me all excited about getting up and talking about this, is because the farmers are the ones that are getting hurt. And that's all I have. Thank you.
Thank you, Mr. Shepherd. Larry, over to you.
Mayor, we have two speakers signed up, and we'll start with Nathan Scott for 3 minutes. Nathan.
Thank you, Larry. Good afternoon, Mayor, Commissioners. Nathan Scott. So I'm in support of adopting the revised Tier 2 structure to 12 kgals. For the last decade, I mean, you guys can sit and pat yourself on the back and virtue signal all you want, but the record clearly reflects that every budget hearing during the last 10 years, I've appeared before the commission to ask you to do what you're actually doing now in terms of resetting Tier 2 to a more appropriate level to be more like the progressive policy the Florida Public Service Commission has adopted for many years on a 3-tier inverted rate structure, which promotes conservation. And it's ironic that, 10 years later, you guys are finally getting around to making at least one prudent utility decision. And like I say, the record speaks for itself. So pat yourself on the back all you want, but it shouldn't take 10 years where you've done the right thing. And yeah, there is some revenue components that results from this, and you've left that on the table for the past 10 years, along with your mismanagement of the utility at the hands of the mayor of the Gainesville City Commission. I am not in favor of adopting or abstating the winter max. I think I agree with the Weather Coalition team that again, that in itself promotes conservation. It provides a basis for helping people reduce their wastewater bill, where it's, you can conserve in a couple months and help conserve and your wastewater aspect, which is pretty expensive, about $9 per block increment, makes a difference on your bill. Say that you are going to be charged actual now, which is 4 or 3 kgals for wastewater consistent with your water consumption, but you were conserved during the winter months. You're going to experience up to potentially a $10 or $20 increase on your monthly wastewater bill now. So I think that's something to be considered. I mean, I think people, if you want to promote conservation, you can do it with the carrot, which is the winter max, or you do it with the stick, which is what you're adopting, which is what the Weatherization Coalition poses. But make no mistake, commissioners, I've asked you for 10 years at each budget hearing to do what you're doing now as to adopting a more appropriate tier 2 water structure on the water side, up to, again, Florida Public Service Commission goes 0 to 6, 6 to 12, and above 12 is tier 3. You guys are finally getting around to addressing the issue with tier 2, and it's been a long time coming. So, again, I just wanted to point that out for your edification. You guys can be disbelievers if you want, but anyone that wants to challenge what I said should just go back and listen to each of the budget meetings over the last 10 years. I actually said this repeatedly and repeatedly, so it's ironic that it's finally come to fruition. Thank you.
Our other speaker is Nancy Darren. Nancy?
Good afternoon, Nancy Darren. I always appreciate when there's a chance to hear Mr. Cunningham. I so thank him and his staff for providing us with such high quality water. When we read the horror stories every day about how many water systems are falling apart, I really appreciate the zeroing in and the focus on conservation, which becomes ever more important as we're all acutely aware, and it's getting pretty scary. Looking at the future, and I really appreciate in this presentation today, Mr. Cunningham addressing and revisiting the UAB concerns from the other night. It's challenging in a lot of ways, but I really appreciate that there is a communication plan, and I urge that any kind of phasing in or communication and education is going to be really important. I guess in my mind, conservation trumps everything at this point. But I do, listening to the concerns from those who have worked with the CWC, and I've worked with my clients over the years to really educate on the winter max. So change is always challenging, but I do appreciate the efforts of Mr. Cunningham, and I deeply respect them. So I just want to thank you. Take care.
And Mayor, those are all the speakers.
Okay, thank you. Appreciate that, Larry. Thank you, everybody, for sharing your thoughts with us. We'll turn back to the commission. Commissioner Simmons.
Commissioner Santos, could you add to the motion to have staff work with CWC and UAB to come up with an education campaign?
Yeah, working with our partners, I think,
Yeah.
definitely.
Okay, so Madam Clerk added to the motion is asking staff to work on a education campaign with community partners. Seconder, okay with that? Yep. Okay, then Madam Clerk, we'll move to a roll call vote.
Commissioner Ward?
Aye.
Commissioner Sacco? Aye. Commissioner Simmons?
Aye.
Commissioner Johnson? Commissioner Johnson?
She said she might be out of pocket, so I think we'll mark her down as absent.
Thank you. Commissioner Ariola?
Aye.
Commissioner Jesus?
Aye.
Mayor Coe?
Aye, that motion passes 6-0 with Commissioner Johnson absent. Okay, Madam Clerk, I think we can fit in our item that was pulled from consent.
Okay, one moment.
And thank you, Mr. Cunningham, appreciate that.
Next, we have the item moved from the consent agenda, number 201005, request for proposal staff ranking, rental housing and energy efficiency inspections, CAP Government, Inc., with the recommendation that the commission approve staff's recommended ranking of the firms, authorize the city manager or designee to negotiate a contract and any related documents with the CAP Government, Inc., subject to approval from the city attorney as to form and legality.
Okay, thank you. And Madam Clerk, Commissioner Johnson just texted me that says that she needs to be let in as a panelist.
She's just been admitted now.
Okay, very good. Thank you. Okay, Commissioner Hey Santos, you pulled this from consent?
Yeah, thank you, Mayor. I think the number one ranked is a good pick, but I have a couple clarifying questions I want to get answered before we move forward. One of them is that looking through the response from the number one bidder, are videos going to be recorded? And I always want to make sure we're not taking videos of people's apartments and then that's available as a public record.
So Commissioner, my understanding is that the video is live streamed, but it's not retained, and Mr. Persons can confirm that.
Mr. Mayor, that's correct. It's very similar to what we were doing in the building department last year during the height of the pandemic, where we were doing a lot of virtual inspections, where you essentially have a contractor on one end of the line with Facebook or FaceTime or Skype or some other video call software, and then the person in the office on the other line. But there's no recording and there's no storage of any sort of video from the inspections.
And there's one more. So if they do find an issue, is a picture taken of that issue for kind of safekeeping, or is that how is it done if they do find an issue, or is that just written down that there was an issue?
No, just like any other inspection, they would have the ability to take a photograph and enter it into the record.
The second portion is they had like I think a plan A and a plan B in their response, and plan B had tenants kind of, I guess, working with them and actually leading the inspection is how I read it, but I want to make sure that we're not, I don't think we're at a place where the tenants should be doing that, definitely having to get up in the attic or looking at the roof. Also, I think landlords might have some influence in there too. So is that a part of it? Like reading plan B, I see that, but for me personally, I don't think that's the place we should go, is having tenants responsible for that.
No, what we will be doing is, or the vendor will be using college students that are learning engineering, and they will be the city's face inside the structure. They will be the ones that will be streaming to inspectors to verify issues, and so it'll be that team, and Mr. Persons could confirm that.
Mr. Mayor, that's correct. The respondent CAP, they had included sort of both ideas in their written proposal, and during our evaluation team discussion for the written proposal, the committee was unanimous in thinking that that was a bad idea. And so when we met with them and had the oral presentations, we explained that was not an option for the city, which they were fine with. They had understood that was they were just sort of spitballing some ideas. So the manager's correct. They'll be, and just to clarify, those are going to be engineering students, but they're actually paid employees of the vendor. So they won't be like volunteers. They'll actually be employees.
And then there is an inspector on the other side of that video stream as well, like an actual like certified Florida inspector, or is that correct?
Correct. Okay. Right. Exactly. And the vendor, they do a lot of building inspections and like normal sort of construction inspections as a private provider. So they have a fully qualified staff of inspectors. They'll also have inspectors who are certified to do the energy audits as well. So that'll be another element of the proposal.
And one other kind of question on the inspection price, I think it came in as a good price. Is there any movement, do you think we'll see on the actual landlord permit of coming down at all, or kind of at the first year we'll try it at that price and see how it goes.
So we're gonna try it at that price. We still, we have an estimate as to what the universe of inspections will be, but we need to narrow in on that number and then fine tune, what the variable costs will be and the fixed costs for running the program. So, but having a contractor where we're not gonna have the variables of, staff, the staffing, I think, will add to the stability of the price. But it may go down in year 2 or it may go up.
Thank you, Mayor.
All right, thank you. Commissioner Saka?
Mr. Mayor, and thank you, Commissioner Santos, for pulling it. I'd had some of those same concerns, and I spoke with the manager prior to the meeting about it, but I think it's good for the sake of transparency to reiterate those in public. And I'll speak for myself, but 3 of my colleagues might agree that the intent was to have a neutral inspector. So I'm glad we're no longer taking the option B where the tenant would be participating, because I think that takes away that neutrality of the inspection that we were trying to impose. I had hoped originally that we would hire city employees to do this, but I can see the logic behind going through a contracted vendor who can hire more students every semester or fewer students as needed and can adjust that way, rather than hiring or firing city employees on a yearly basis. So I am, with these clarifications in place, I am comfortable moving forward with staff's recommendation.
Okay, excellent. Thank you. Commissioner Santos?
Mayor?
Yeah, go ahead. Go ahead, Andrew.
Thank you. I did want to point out, because I think it's worth mentioning, that we are, from the city side, we are bringing on some staff that will do a lot of the intake, a lot of the processing, like helping schedule the inspections and doing follow-up. So I think to Commissioner Sacco's point, there will be a touch point with the city and from the permittee and the tenants. There will be a lot of interaction between the city and the tenants and landlords. So it won't be that the city's just sort of outsourcing all of the whole program to an outside vendor. So there will be that touch point with the city, and for the most part, most of the interaction will be between us and the tenant and landlord. It's just the inspection itself, the in-person inspection, that'll be handled by the vendor.
All right, thank you. Commissioner Santos?
Yeah, thank you, Mayor. One other, so I was watching the webinars that the city has been putting on, and it seems like I think the intent of the subcommittee and what the motion, or at least my intent of the ordinance may not be reflected in the actual ordinance when it comes to owner, like if I own a property and I'm renting out one of my rooms in the same unit, that person wouldn't need a landlord permit. It was more for people who were like, you're renting out a structure and that structure doesn't have anybody related to you, then that would be a landlord permit needed. Is that still how staff is reading it, or are you all having any plans for bringing back some changes to us on the ordinance?
Yes, thank you, Mr. Mayor. We are. We completed our final webinar this morning, informational webinar. So we actually have a number of items that we've heard through that process that we'll be bringing to the commission at your first meeting in May, on May 6th, for a check-in, a debrief, and then some options for the commission to consider potential ordinance tweaks before this goes live in October.
All right, thank you. I'd like to move staff's recommendation.
Okay, motion by Commissioner Santos, seconded by Commissioner Sacco to move staff recommendation. Anybody in the chambers wish to comment on the motion? Mr. Shepherd?
Yes, my name is Donald Shepherd, the People's Representative, and in doing that, this has been an ongoing problem for years now that we have brought to the City Commission. Landlords have brought to the City Commission, renters, students have brought to the City Commission, and still yet this is not resolved. These here permits and these overviews and list of contractors and stuff has been a whole spin of a ball of the wheels of the city commission and county also. Where's the resolution? Where's the resolution to this? Are we gonna go another year of this unanswered question from the landlords and from the contractors and the people and staff and all that has placated this for years? This here, Nathan Scott has been asking for over a number of years. A number of people that came to this podium have been asking this question about this, and no answers. So that's what I wanted to bring in behalf of the people, in behalf of the landlords, and the scum landlords out there are still out there. Nobody's helping the renters and the students from getting shanghaied, as a Japanese or Chinese statement, of signing a contract, and then they're stuck. They're having to pay contracts of reviews of the apartment when they review it, and then they make them sign a contract, and the student is like caught with their hands folded, and here comes out of their wallets money that they shouldn't have to be paid, and we're finding more and more students homeless throughout our city, and I ask that we take attention to this and our boards really back our students and our residents so that we don't have an additional amount of homeless people to come. Thank you.
Thank you. Larry, over to you.
Thanks, Mayor. We have Sheila Payne standing by. Sheila, you have 3 minutes.
Okay, so here I wrote that great letter and y'all have answered all the questions. I'm glad that the tenants will have no responsibility except to open up the home. The Alachua County Labor Coalition, shoot, I still have audio on, sorry. Will have nothing to do except answering the door. The Alachua County Labor Coalition is comfortable with training U.S. engineering students doing the work. I hope that the vendor will pay them the city living wage for contractors. I wanted to find out if this will start being implemented this October or in a year. And I want to make sure that the U.S. students are going into the rentals. Right now, code enforcement is not going in and people have given up trying to get help. Let's see. I'm glad the city staff will be the contact. I can't see us being able to do that. So, y'all answered the question. We do not want any video recording being stored. We also had hoped that in the speedier process that in-house inspectors would be used by the city, but I guess we'll have to see how it goes. And I want to know if there's a violation, will the inspector go back in a timely manner to make the final call on the violation? Also, for something that Adrian brought up, Commissioner Luis Santos, when this ordinance was being drafted, it was never intended for a person living in the home, renting a room to have a permit. And I was on some of those community calls. I would be interested in seeing how y'all tighten that up. So thank you. I hope y'all read my emails. They're way more coherent.
And Mayor, that's the only speaker.
Okay, thank you. To answer two questions quickly, yes, it goes live October 1, and yes, the inspectors will enter the house. And Andrew, I think I know the answer to this third question, but just to make sure, the city will be the final arbiter of any violation, correct?
Oh, yeah, of course.
Right, yes, okay. I think that's all the questions I heard from Ms. Payne that weren't already answered. So thank you, everybody. Thank you, especially you, Andrew, and your team for your work on this. And Madam Clerk will move to a roll call vote.
Commissioner Sacco?
Aye.
Commissioner Simmons?
Aye.
Commissioner Johnson?
Aye.
Thank you. Commissioner Ariola?
Aye.
Commissioner Hayes Santos?
Aye.
Commissioner Ward? Mayor Poe?
Aye, that motion passes unanimously. Exciting, one step closer. I believe now we're back to commission comment. Commissioner Ariola?
Thank you. So really quickly, this was more of a question for our staff. We're getting close to that time of the year where we have to make decisions about disbursements of CDBG funding. And I have heard some rumors that some funding from last year was never dispersed. And I just wanted to bring that to the attention of our management so they can get down to the bottom of it.
Okay, thanks for, and we'll ask the city manager to give a memo to the commission about any unspent funds from last year. Those are, I don't think with any exceptions, always reimbursable. So if someone applied and then didn't actually do the project, then they wouldn't have been able to get that. But yeah, Mr. Feldman, if we can get an update on unspent funds from last year.
Yeah, and I can just comment real quick on that. Because of COVID, certain programs were suspended, and then those funds were scheduled to be reprogrammed for these future years.
Okay, well, if we can just get a kind of list or an update, that'd be helpful.
Yeah. Okay, that's fine.
Okay, very good. Commissioner Johnson?
Thanks, Mayor. I'd like to give a short update on what's happening with HB1. Right now, it's passed the House, it passed Senate Appropriations, and right now it's in the Senate. They're debating it, and it's expected to pass today. And then it will be signed into law pretty quickly, probably within the next couple of days or so. And I know that we talked at our last meeting about any legal challenges that will come up, and us considering being a part of those, either as the amicus briefs that might come forward, or even as a potential plaintiff in any of the suits. I know that there are many organizations right now across the state that are preparing for a legal challenge, and I'll have more information about that. But just kind of wanted to give you an update so that I can come prepared at the next meeting, likely on May 6th, with some additional information for us to consider.
Very good. Thanks for the update, Commissioner. And while we've got you, I wondered, so we made a motion earlier. There were 4 resolutions on the agenda, and we ended up moving that all 4 will come back at the earliest possible date for consideration after I develop a new procedure for advocacy resolutions as opposed to legally binding resolutions. Did you want to add the resolution from last night to that as well? Do you want that to come back once we've established that?
That would be fantastic. And also, I thought that we also had an HB1 resolution coming back. I haven't been in touch with staff about that, but
Okay.
I'd like to add that as well.
So in this process, any commissioner will be able to ask for a resolution to be put on the agenda through this new procedure. So we'll just, if you'll just kind of keep touch with staff and make sure that they bring that back, once we get this in place. But yeah, absolutely. Okay, over to Commissioner Sacco.
Thank you, Mr. Mayor. So after conversation that we had yesterday, I started thinking, and other conversations, I started thinking about where we would be best serving our community by spending American Rescue dollars. And one of the things, it's going to require some information, which is why I want to bring it up now. I think regardless of what Treasury guidelines we receive, it's the intended purpose is to offset the cost burden of the past year and a half and to revitalize our communities. And so one thing that I'm interested in, and I think some of my colleagues have asked for in the past, is we have a number of shut-off utilities, and we also have a number of folks on payment plans that they just might not be able to repay while paying their current month payment. So one thing I would like to ask GRU to do and bring forward for all of us is just an assessment of how much money is in those payment plans, how many people are managing to make those payments, and how, I guess a clear and expert opinion on whether we'll be able to recover those funds, or if it's within the guidelines, which I think it would be, if we can not promise, but consider a future use of that of the money we'll receive to reimburse GRU for payments that just won't be made realistically. I think it takes the burden off our neighbors who will never be able to catch up, while also making GRU whole. And so my only ask at this moment is that GRU kind of collect those numbers and send it to us in terms of how many shutoffs there are, how many payment plans are currently in place, and what the total amount would be, to give us some idea of whether this would be a viable avenue to explore.
And do you want the starting point for that to be like March 2020?
I think so, yes.
March, okay. Okay, so Mr. Bolarski, I assume you heard that request. You can just send that to the full commission. Commissioner Johnson?
Thank you, Mayor. I wanted to mention that we are having hopefully a robust discussion about the American Rescue Plan. And I can't remember what date, but I asked for it to be on a general policy meeting for all of us to discuss. And I absolutely love that idea, Commissioner Sacco. And I would hope that maybe all of us can come to the table with some ideas so that we can give the city manager some direction about the American Rescue Plan.
Thanks. Yeah, I think Treasury guidance is supposed to come out at the end of this month.
May 13th?
Yeah, I think Treasury guidance is supposed to come out at the end of this month, and then once we get that, we'll have a better idea of what our, sort of restrictions are or lack thereof. So yeah, May 15th, you said, City Manager?
May 13th is the GPC discussion on
Okay,
this.
excellent. Yes. Excellent.
Fantastic, thank you.
Okay, Commissioner Santos?
Thank you, Mayor. On the utilities, I'd like to get a better idea of, and I guess maybe this is reaching out to the county, but the county has $8.5 million they allocated for the specific reason of helping people with their outstanding utility bills related to COVID. And how is GRU trying to, is GRU getting that information to those members who have outstanding bills? And also, I'd like to get an idea of how much the county has allocated and spent so far, and how much is left of that. Thank you, Mayor.
Okay, so Mr. Bolarski, if you'll add that to the information coming back to us, it'd be fantastic. Commissioner Sacco.
Clarification that I might have overlooked. If possible, I'd like it divided by city limits use versus outside of the city limits, because you're right, there is money at the county level that should be tapped into for those who do not live inside the city, and even those who do live in the city, they should be tapping into those dollars. But should they be barred for whatever reason, or if the process is too difficult at the county level, I'd like to see within the city limits what we can do to pay off those utilities for our neighbors. I would also, I would theorize that it would be possible to collaborate with the county to see if we can just transfer a chunk of that to the utilities, because at the end of the day, it does benefit members of the county, because we don't serve people outside of our county. But I don't know how far that discussion would go with the county. Thank you.
All right, thank you. All right, seeing no further comment, I have nothing, so we will be in recess until 5:30. Okay, good evening, everybody. Welcome back. This is the evening portion of our regular City Commission meeting, April 15th, 2021. We're glad that you're all with us. Madam Clerk, our first order of business this evening.
The first order is the Pledge of Allegiance.
Okay, please stand if you're willing and able, and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please have a seat. Madam Clerk, next item, please.
Our first item is the first proclamation, number 201043, National Public Safety Telecommunicator Week, April 11th through the 17th, 2021.
Okay, is there anybody here to receive this proclamation? Come on up here. Sure, yeah, you can both come up, absolutely. Thank you for being with us.
Thank you for having us.
Whereas the professional public safety telecommunicator in Alachua County plays a crucial role in the protection of life, property, and delivery of public safety services. And whereas each day hundreds of citizens dial 911 for help in emergencies, and the telecommunicators who answer these calls for help, gathering essential information and dispatching the appropriate assistance, can often make the difference between life and death for persons in need. And whereas these well-trained, highly dedicated, and deeply motivated individuals proudly and selflessly serve the citizens of Gainesville 24 hours a day, 7 days a week, sometimes during extreme situations such as hurricanes, and are unable to be with their own families or protect their personal homes and property. And whereas telecommunicators, who are the original first responders, are honored to receive recognition by the citizens and agencies who depend on them and benefit from their services. And whereas the Congress of the United States has proclaimed its support and recognition to these employees and their profession, and the City Commission wishes to publicly recognize the local telecommunicators who serve the citizens of Gainesville in such a professional manner. Now, therefore, I, Lauren Poe, by the authority vested in me as the mayor of the City of Gainesville, do hereby proclaim April 11th through 17th, 2021, as National Public Safety Telecommunicator Week in the City of Gainesville, and invite all of our citizens to join me in recognizing our public safety telecommunications heroes. In witness whereof, I have hereunto set my hand and caused to be affixed the official seal of Gainesville, Florida, this 6th day of April, 2021. So we'd love if you would offer a few words and introduce yourselves.
Hi, my name is Destiny Robinson. I am a telecommunicator with the Alachua County Combined Communication Centers. On behalf of all of my coworkers, I would like to thank the Board of City Commissioners and the fellow citizens of Alachua County for taking the time to acknowledge us, the National Public Safety Telecommunications Week 2021. Thank you.
Thank you. We appreciate you having us here tonight.
Thank you so much. Thank you for all the work that you do, and please extend that to all of your colleagues. Okay, Madam Clerk.
Next item is the second proclamation 201099, Arab American History Month, April 2021.
Okay, anybody here to accept this proclamation? Come on down. Thank you for being here this evening. Whereas the United States is home to more than 3.5 million Arab Americans, representing a diverse array of cultures and traditions. And whereas members of the Arab community began immigrating to the United States in the late 1800s, fleeing war, persecution, and economic hardships. And whereas, since migration to America, men and women of Arab descent have shared their cultures and traditions with neighbors and friends. And whereas Arab Americans trace their origins to 22 Arabic-speaking countries in the Middle East and North Africa. And whereas, across the country, cultural institutions, school districts, municipalities, state legislatures, and public servants will engage in special events that celebrate the Arab community's rich heritage and numerous contributions to society. And whereas individual states, including Arkansas, Hawaii, Michigan, New York, North Carolina, and Virginia, have recognized April as Arab American History Month in past years. And whereas 2021 marks the first time the U.S. State Department has designated April as Arab American Heritage Month. And whereas our neighbors of Arab descent have helped to infuse our nation with strong values, work ethic, and dedication to education and diversity of faith traditions that have strengthened the foundations of our democratic republic. Now, therefore, I, Lauren Poe, by the authority vested in me as the mayor of the city of Gainesville, do hereby proclaim April 2021 as Arab American History Month in the city of Gainesville, and invite all of our citizens to join me in celebrating the Arab American culture and way of life, and working together to create a peaceful and diverse society where every individual is treated equally and feels safe. In witness whereof, I have hereunto set my hand and caused to be affixed the official seal of the city of Gainesville, Florida, this 9th day of April, 2021. Please, yeah, make it.
Hi everyone, my name is Rachel Khoury. I'm a student at UF, a resident of Gainesville, and a proud Arab woman. I want to thank the city today for recognizing this month as Arab American History Month. We hope the city continues to work with the Arab community and other communities of color to make this a more inclusive and welcoming city for us all. And as we continue to fight xenophobia and Islamophobia in the Arab community and all over the country, gestures like this offer us conversations as to how we can all become greater neighbors to one another. As Layla and I and the Arab community continue to fight for representation against the illegal occupation of Palestine and many other injustices, we thank Gainesville for recognizing us today. Thank you.
Thank you. We'd like to thank you both for being with us, and just point out that some of our strongest sister city relationships are with cities in Arab countries, including Kikilia in Palestine. Very long-lasting and very close relationship. We also have a sister city in Deir Allah, Jordan. We have one in Lebanon. And although it's not Arab, we have a sister city in the Kurdish part of Iraq that we're just renewing. And so we very much celebrate and feel honored and blessed to have the relationships that we have both here locally with our Arab American community as well as our sisters across the ocean. So we'd love to keep you all involved with that and look for ways we can further elevate and raise up those voices. So thank you so much for being with us tonight. We really appreciate you being here. Okay, Madam Clerk, next item, please.
Next is the final proclamation 201100, Terry Fleming Day, April 28, 2021.
Okay. There's about a 0% chance I make it through this this proclamation without crying. We lost Terry, early in the pandemic. And it was so hard for so many of us that were friends of his because we didn't get to say goodbye. And all of us that knew Terry and worked with him and depended on him, he was always there. I mean, that was the thing about Terry. He was always there. And so while we were all dealing with our own trauma of the pandemic, all of a sudden this person who'd been such a rock in all of our lives was no longer there. So it's been tough, and there's been many times, many occasions, many issues where I've wanted to take out my phone and call Terry and say, hey, I need your help, or what do you think about this thing? And his number's still in my phone. I can't delete it. It's with great sadness, but also gratitude that I present this proclamation tonight. Whereas Terry Patrick Fleming was born in Bloomington, Illinois in 1961, served his nation honorably in the United States Navy, and, to the great fortune of our city, chose to make his home in Gainesville. And whereas Terry was an activist and a patriot in the best sense of the word, who believed with every fiber of his being in serving all the communities that make up this world with all of the energy he could muster. And whereas no other activist has done more to demand that LGBTQ rights are basic human rights, and to help everyone understand that the LGBTQ community is comprised of men and women from all walks of life and are active participants in making our community vibrant in spirit, in his own words, from 20 years ago. And whereas Terry's work in developing the Pride Community Center of North Central Florida into a national model of service that changes and saves lives will never be duplicated. And whereas the success of Gainesville's annual Pride celebration is an ongoing testament to Terry's dynamism and dedication. And whereas, in addition to Terry's leadership in the LGBTQ community, his impact on the local Episcopal Church and Democratic Party communities, and on the local struggle to improve the lives of our homeless and hungry neighbors cannot be overstated. And whereas when our community suddenly lost Terry Fleming on April 28th, 2020, we lost a man who is a true friend to more people than we will ever know, a dedicated uncle and brother, a devoted son, and a loving husband. Now therefore, I, Lauren Poe, by the authority vested in me as mayor of the city of Gainesville, do hereby proclaim April 28th, 2021 as Terry Fleming Day in the city of Gainesville, and invite all of our citizens to join me in honoring him for his contributions to the life of our community and in treasuring the blessing of his memory. In witness whereof, I have hereunto set my hand and caused to be affixed the official seal of the city of Gainesville, Florida, this 12th day of April, 2021.
Hello, my name is Tamara Perry Leonardo. I'm president of the Pride Community Center of North Central Florida. And I'd like to thank this commission, Mr. Mayor, for recognizing our dear friend and leader, Terry. On behalf of the Pride Community Center, I want to thank you for making perhaps a bright spot in a very dim year. Terry was not only a leader and an advocate, but a man of deep faith. And when I heard that Terry Fleming Day was going to be on the anniversary of his death, I couldn't help but feel that that was a bit of redemption. That was Terry reminding us that the end isn't the end, that we continue the work that he started. So I thank you for this honor on behalf of Pride Center. We aim to keep up Terry's good work with the help of Gainesville. Thank you.
Thank you.
I am Terry Fleming's mother, and I'd like to thank you for this honor. When Terry got out of the Navy and decided to come to Gainesville, he said, "I'm going to tell you right now, I'm going to be an activist." And I said, "Terry, that's fine." But I didn't realize how much of an activist that he was going to be. And it worried me because he was so involved, and I said, "Terry, you've got to slow down, you've got to slow down." And he said, "Mom, you don't know how many people are in need out there. I can't." And I said, "But if you collapse, there'll still be a need," and that's what happened. And I really thank you for this honor, and somehow I think he knows. I really believe that. Thank you again.
Thank you. And just thank you for sharing your son with us. He's as Gainesville gets. He's 100%. Would anybody else like to say any words? If you'll just give us a sec, we'll get the lectern cleaned. Thank you, Ms. Malden. Welcome, Ms. Fox.
Thank you. Good afternoon, Mr. Mayor and Commissioners. I feel honored to be here for this recognition of, I call Terry my brother, and we did so many things together. We just connected. Terry just connected with everybody. He was an activist as well with the NAACP, the Alachua County branch. We could not have done a Souls to the Pole without Terry Fleming and all the other things that he did. So I feel honored and I am elated that the city decided to honor Terry on the 28th of April, and hopefully we'll have a great celebration on that day, Linda. Okay, thank you all so much and have a good afternoon.
Thank you. Would anybody else like to say anything? Hey, Dottie.
Hi, I'm Dottie Fabacy. I've known Terry Fleming for a long, long time, and I cannot delete his number from my phone either. And I just want to say thank you so, so much for honoring Terry. He has done so much for so many of us. Thank you so much.
Thank you. Welcome.
My name's Father Les Singleton, and I'm not the only Episcopalian in the building. So happy that Terry Fleming did good our diocesan convention, speaks of love, inclusiveness, just a man, a shining light that willingly embraced all people of all attitudes, whether they liked what he said or not. He was a loving man, a great example that we all do well to emulate. Thank you for honoring him.
Amen. Anybody else? Well, we're so grateful that you all chose to come and share this evening with us, and we will continue to honor Terry by our works, right? That's what he will ask of us, as we continue to honor his legacy through our works. So that is our challenge before us. Commissioner Ariola, you wanted to make some comments?
Thank you, Mr. Mayor. I just wanted to share from my heart. When I moved back to Gainesville, Terry was one of the first people that I met at various different community events. I was always so amazed at his personality and the way that he worked so hard to be there for everyone and lift people up. And I very much felt that myself. And so I feel that spirit again in this room. And he was everywhere, and he tried so hard to be there for so many people, and it was really special to get to know Terry, and I feel honored to be here today to honor his memory. It means a lot to me.
Thank you, Commissioner. Commissioner Santos.
Thank you, Mayor, and thank you all for being here to celebrate his life. Terry was an amazing person. From working with him, helping him out there at the Pride Center, I remember helping him load mannequins into a truck when he was doing that, to one of the last things I remember working on him with was the crosswalks, the rainbow crosswalks. And every single time I walk out of City Hall or go across any of those, Terry did that, and it's a reminder of every time walking there, and it feels good, because he, and he got things done. I loved talking with him about the strategy of how we would get something through and passed, and it just brings a smile to my face of how he got stuff done. He made change, and his change will last, and his change will grow from there too. Thank you.
Thank you, Commissioner. Commissioner Ward.
Thank you, Mr. Mayor. Many people will tell you that you should never buy a truck because people might need to borrow it, and so you don't want to have it. So when Terry bought a truck, I said, Terry, people are going to want to borrow that. And he said, yeah, that's why I bought it. That's who Terry was. He needed another vehicle, and he thought, how could this be helpful to people? I used to have lunch with Terry every Friday, had coffee with him at church every Sunday, and for years, I'm pretty sure I saw him every other day, either in this building or across the street at the county administration building. Sooner or later, COVID will be over, and we'll go do the things that we always did. But for reasons like this, we'll never go back to normal. So thank you all for being here. I really appreciate it. And we're all better for having known Terry.
Thank you, Commissioner. Commissioner Simmons.
Mayor, thank you all so much for coming out and showing your love and support for Terry. I knew him for a short time, and he made an impression on me the very first time I met Terry. I would go out to various locations, and he was always there. And I noticed how involved he was. He was everywhere. He was like a busy bee. He was helping everyone, and that really impressed me. I had never seen anyone that was always there, that was always doing something good, that was always doing something positive. He was someone, when you look from afar and you see him and you zero in on him, he was extremely passionate about people, and he left an impression on me. And I just want to say thank you so much and for sharing your son with this community. He made an impression on me in a short period of time that I knew him. So thank you all so much.
Thank you, Commissioner. Commissioner Sucker.
Thank you, Mr. Mayor. Thank you all for coming out here to help celebrate Terry. You often don't know when it's the last time you're going to see someone. And sometimes it's hard to remember the final conversation or the last time you saw a person, because you don't catalog it as that. It's just another time that you're seeing them. But I remember the last time I saw Terry. It was the morning of our election, and I was putting signs out, and he drove up to a polling station he was going to volunteer at, because of course he was. Even as pandemic was starting, he said, screw it, I'm gonna help out because people need help. And he saw me, he saw that I was an anxious little ball of a mess, and he just gave words of encouragement and kindness and just love. And I think he did that for every person he came in contact with. So it's a bit of a bittersweet memory, because just a month later we all got the news. But I hold tight to that memory, and every time we bring up Terry, every time we cross the rainbow sidewalk, I think of Terry, and I think of that last day, and I can picture it so vividly. And I think it just exemplifies the relationship I had with Terry, where I met an older activist and I wanted to be like him. So I'm incredibly glad for the precious little time I got with Terry. Thank you so much for sharing your son with us and for raising him to be the wonderful person he was. I'm glad that we're all here as a testament to how his memory is not going to fade, how we'll keep him alive through the community that he helped bring together. And I'm so grateful to have that comfort. Thank you.
Thank you, Commissioner. Again, thank you, everyone. We will continue to work to find ways to honor and remember Terry. And, you know, so I'll be reaching out to the Pride Center and the family and make sure that what we do is what Terry would want and what represents his memory. So this will be something that we can continue to honor him with. So thank you all for coming down. You are welcome to stay for the rest of the meeting. We've got some exciting resolutions coming up. Terry would want you to. No, even Terry knew better. He would not. He would know when to come for his item, and then he would be out of here. He was a smart activist. He used his time wisely. So if you would all like to go do other things with your time, we honor and respect that, and we'll give you a little moment to do that. Yes. Of course.
I think probably all of you knew that Terry was able to go to Washington, D.C. and meet the President Obama. And he came back, and then he had a lot to do with, Michelle came to visit at the University of Florida. And while he was setting everything up, while his partner was backstage having coffee with her. And Terry said, "You owe me." Or no, excuse me. Yeah, Terry said, "You owe me." And Vertigo said, "I don't owe you anything." He said, "Yeah, you were back there having coffee with her, and I was out here getting everything set up." And but he so much enjoyed it, and he was a true activist. I agree. And thank you so much for this honor.
Thank you, absolutely.
Thank
It
you
just
very much.
means so much that you were here. Thank you so much. All right, y'all. You have a good rest of your evening.
We'll follow the heroes.
Heavy duty. Thank you, neighbor. She's my actual physical neighbor. I'm not using it in the larger colloquial sense. I help her with her recycling sometimes. Okay, is it 6? I think we can. Yeah, perfect. Okay. So Madam Clerk, our next item, please.
Next, we have the first resolution, number 200990, resolution local agency program agreements for Northwest 19th Lane multimodal project, with a recommendation that the commission adopt the resolution and authorize the city manager or designee to execute all contract agreements and any other necessary documents with FDOT pertaining to this project, subject to approval of the city attorney or designee as to form and legality.
Thank you, Madam Clerk, and Ms. Malden, thank you again. Mr. Feldman, did you want to say anything about this?
This is one of our standard agreements that we have. This is a FDOT funded project that we will administer. They pay the cost. This just allows us to move forward.
Okay, very good. Thank you. Commissioner Santos.
Thank you, Mayor. I move resolution 200990.
Okay, motion by Commissioner Hayes Santos, seconded by Commissioner Sacco to approve the said resolution. Anybody in the chamber wish to speak to the motion? No. Larry, I'm sorry, we have Adam. Hello, Adam. You are very brave for coming back. We had you here incredibly late last night.
It was a bit of an evening, sir.
Do you have anybody wishing to comment on this motion, Adam?
I will say it was just great to see all three groups coming together as they did first time in years. So thank you for that opportunity. No, we have no one on the line at this time. The floor is yours.
All right, thank you. Madam Clerk, we have a roll call vote.
Commissioner Simmons?
Aye.
Commissioner Ward?
Aye.
Commissioner Sacco?
Aye.
Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Hayes Santos?
Aye.
Mayor Poe.
Aye, that motion passes unanimously. Next item, please.
Next, we have item 201095, Hazard Mitigation Grant Program for Hurricane Irma Disaster Declaration, FEMA 4337-DR-FL, with the recommendation that the City Commission authorize the mayor to execute a resolution to authorize the general manager of utilities to execute the grant agreements and related documents, subject to approval of the city attorney as to form and legality.
Okay, Mr. Feldman, anything you want to say about this one?
This one's actually Mr. Belarski's.
Oh, okay. Mr. Blarsky.
Yeah, I don't have anything to add, Mayor.
Okay, just accepting a FEMA grant, correct?
That's correct.
Okay, thank you. Any questions, or is there a motion? Any questions? Oh, Commissioner Simmons.
The resolution to authorize the general manager to execute the grant agreements and related documents subject to approval of the city attorney as to form and legality.
Okay, is there a second? Okay, motion by Commissioner Simmons, seconded by Commissioner Ward, to adopt resolution 201095. Adam, anybody from the public wishes to comment on the motion?
No, Mr. Mayor, there's no one on the line. The floor is yours.
Okay, Madam Clerk, roll call vote.
Commissioner Simmons?
Aye.
Commissioner Sacco? Aye. Commissioner Ariola? Aye. Is that aye? Aye. Commissioner Ward?
Aye.
Commissioner Hayes Santos?
Aye.
Commissioner Johnson?
Aye.
Mayor Poe?
Aye, that motion passes unanimously. Next item, please.
Next item is 200999, acceptance of grant funding for hurricane shelter retrofit at Grace Marketplace, with the recommendation that the City Commission adopt the resolution and authorize the city manager or his authorized designee to accept the allocation of state hurricane shelter retrofit grant funding and execute the grant agreement, supplemental agreements, extensions, assurances, certifications, and all related documents, subject to approval by the city attorney as to form and legality.
Okay, thank you. This is pretty self-explanatory. Are there any questions, or is there a motion? Commissioner Ariola?
I move resolution 200999.
Motion and a second to adopt the proposed resolution. The motion was by Ariola, the second by Ward. Adam, any members of the public?
Mr. Mayor, there is no one on the line at this time. The floor is yours.
Okay, Madam Clerk, roll call vote.
Commissioner Hayes Santos?
Aye.
Commissioner Johnson?
Aye.
Commissioner Simmons?
Aye.
Commissioner Sacco?
Aye.
Commissioner Ward?
Aye.
Commissioner Ariola?
Aye.
Okay, that motion passes unanimously. Next item, please.
201058, second budget amendment to the FY 2021 General Government Financial and Operating Plan budget, with the recommendation that the City Commission adopt the proposed resolution.
Okay, thank you. This was recommended out of Audit and Finance. This is our second amended budget resolution. Are there any questions, or is there a motion?
Mr. Mayor, I will move adoption of resolution 201058.
Is there a second?
Second.
Motion by Commissioner Ariola, seconded by Commissioner Ward, to adopt the proposed resolution. Adam, any members of the public?
No, sir. There is nobody on the line at this time. The floor is yours.
Okay, Madam Clerk, roll call vote.
Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Sacco?
Aye.
Commissioner Simmons?
Aye.
Commissioner Ward?
Aye.
Commissioner Hayes Santos?
Aye.
Mayor Poe?
Aye, that motion passes unanimously. Next item, please.
The next item is 200281, quasi judicial historic property tax exemption, 716 Southeast 4th Avenue. An ordinance of the City of Gainesville, Florida, finding that property located at 716 Southeast 4th Avenue, Gainesville, Florida, as more specifically described in this ordinance, qualifies for an ad valorem tax for historic properties. granting an exemption from ad valorem tax for certain improvements beginning January 1st, 2021, and continuing for 10 years under certain conditions, authorizing the mayor and the city clerk to sign the historic preservation property tax exemption covenant between the property owner and the city, providing a severability clause, providing a repealing clause, and providing an effective date.
Okay, thank you. Commissioner Hayes Santos.
Thank you, Mayor. Brought up concerns last time, and I just wanted to bring those concerns back again. And I'm not going to support moving forward on this. This is a $400,000 in tax exemption. This is in essence subsidizing of luxury single-family home, and I don't think that's something that we should be subsidizing as a government, subsidizing a luxury single-family home. This was a smaller, more affordable home, and now it's a luxury home. This is one of my issues with historic districts is they lead to this. They lead to increased housing values and make things unaffordable, as what's happening with this home here. And we are subsidizing as a government by giving an exemption. We should at least put, I think, dollar caps on the exemptions that we give so that we don't have there's not kind of an incentive to spend a lot of money or to make them more, or so they don't get as unaffordable. Thank you, Mayor.
Thank you. Commissioner Sacco.
I just have a question for the sake of clarity. Is the tax exemption permanent?
No. It's a 10-year. Yeah, Andrew, you want to explain the way that works?
Sure. Yeah. So thank you, Mr. Mayor. It's not permanent. It does last for 10 years. It requires both city commission approval as well as county commission approval, and then ultimately it's the property assessor's office who actually determines the amount of exemption, and it's applied over a 10-year period.
So in 10 years, we'll be back here again?
No, it's only good for 10 years, so it basically freezes the value of the home with sort of before the improvements were made. So there's not an increase in there won't be an increase in value of the home for tax purposes based on the work that they've completed for a period of 10 years. And then after 10 years, then it's basically reassessed at the current value, including the improvements that were made.
So it comes back to the commission again in 10 years?
No.
It just is
Sorry, I'm
automatically.
stuck on that.
It's just one time.
Oh, okay. Got it. Thank you, Andrew.
Yep.
Commissioner Simmons?
Yeah, and Andrew, just to clarify, the owner had to do extensive work to meet the criteria, correct?
That's correct, Mr. Mayor. The way that the ad valorem tax exemption process works is there's actually two parts. One part, the owner goes to the Historic Preservation Board before any work is done, says, this is what we're going to do. We're going to make these types of improvements. The board says, okay, that sounds good. Make sure that you do them in accordance with the city's guidelines as well as Secretary of Interior guidelines. And then the work happens, and then they go back to the board for the part two, say, here's all the work that we've done. The board says, looks good, meets all the guidelines, meets the Secretary of Interior standards, approves the part two, and then that goes to you, the city commission, for the final determination and okay. So you guys are okaying the exemption or not okaying the exemption. And then, as I said, that's just the city part of the ad valorem. Then the county also has to approve for the county's portion of the ad valorem exemption.
On second reading, 200281.
Is there a second? Okay, motion that we adopt the proposed ordinance on second reading by title only. The motion was by Commissioner Simmons, the second by Commissioner Ariola. Commissioner Hayes Santos, you make some good points, and I think it warrants further discussion because we've set a precedent. I'm not inclined to deny this individual, but I would be open to having a conversation about. We haven't looked at this program in a long time, and so looking at the impact that it has on affordability, looking at the impact it has on neighborhood revitalization, looking at maybe some alternative ways of doing this. I'm completely open. I think it's, you know, especially programs like this deserve to be reevaluated periodically, and we certainly have not done that since I've been on the commission. So that's a good indication. It's time to do that. So, you know, we'll keep that in mind, and possibly next time we have a joint meeting with our historic plan board, historic preservation board, this could be a good topic of conversation. So we'll keep that in mind. Okay, Adam, we have a motion on the floor. Anybody from the public wish to speak to the motion?
No, Mr. Mayor, there's nobody on the line.
Okay, Mr. Shepherd, interested in this item?
To your meeting. My name is Donald Shepherd, people's advocate, and so I'm trying to find out where I'm at in this agenda.
We're on the last item on the agenda, the property, historic property tax improvement exemption.
Okay, about property taxes, I think they're way too high right now. If I was in the mayor, I'd be cutting them by 3/4, because I don't see where this continuous load on the citizens is needed at this time. Here we went through COLA, here we went through numbers of these raising of utilities and other stuff that has affected the schools. So I vote that we cut this tax down to like $86 per homeowners and like $130 for businesses. I have to review this more to take and give you a correct number. It's off the top of my head. That's what I'd like to do. But I do not vote this orders into effect. And I think you were correct, Mayor Pohl. You need time to review this and make a proper decision of how you're going to interact on what has been put before you. So that was a smart decision, and that's all I have to say, sir.
All right, very
Thank
good,
you very
Mr.
much.
Shepherd. Appreciate that. Okay, so Madam Clerk, we'll turn back to the commission for a roll call vote.
Commissioner Ariola?
Aye.
Commissioner Johnson?
Aye.
Commissioner Sacco?
No?
Commissioner Simmons?
Aye.
Commissioner Ward?
Aye.
Commissioner Hay Santos?
No.
Mayor Poe?
Aye, that motion passes 5-2 with Hay Santos and Sacco in dissent. Okay, next item, please.
Next, we have item 201097, Commissioner Gigi Simmons.
All right, so the meeting of the evening. We get to, my good friend Hutchinson used to call this whack 'em and plack 'em, which I love. We are all honored to be able to honor you tonight, Commissioner Simmons. And so let me talk a little bit about how this is going to work. By the way, we all agreed in the back of all the pictures, and I haven't seen mine yet, so I don't know, but I can't believe it's better than this one. We think that you took the best picture out of everyone. By far, it's not even close. It's not even close. I'm going to first acknowledge the charter officers and anybody else from staff that would like to recognize Commissioner Simmons. I will then turn to any members of the public that would like to say anything out of respect for Commissioner Simmons, and then we'll turn to the commission. And then Commissioner Simmons will allow you to bring us home. Are these lights before we get going? For later? Okay. They're lining up. They want to be first. Okay, so In no particular order, I guess I'll start off with the city manager. Or actually, let me check my participants. And well, you know what? I'm going to go with Mr. Bolarski because he put his hand up, and that's just you take the teacher out of the classroom, but you can't take the classroom out of the teacher. So, Mr. Bolarski, I'll recognize you first.
Thank you, Mayor. This is an auspicious, I guess, moment for Commissioner G.G. Simmons. I do remember Commissioner Simmons, you know, before you were a commissioner, and some of the events that you held in the community. Oh, I don't have my video up.
We prefer it that way, sir. Commissioner Simmons asked for that.
Yeah, I remember when you were not a commissioner, but simply, you know, serving your community. And we had several meetings when I was introduced to you by Yvette Carter. I still remember sitting down next to the Starbucks outside, and we were in our, you know, at the little table there. And I was going off like often I do, and you're kind of looking at me like, boy, is this guy for real? I still remember that moment. And, you know, you were so serious and so focused. And I just want to commend you for, you know, the community advocacy that you've undertaken, you know, whether you're a commissioner or whether you're not commissioner. I don't think you're going to change. I think you're just going to continue doing, you know, what you do. And you're going to be a force in the community and one that has to be reckoned with. Moving forward a little further, I still remember going down on one of the weekends when there was an event at Borders, and you know, you had your backpacks. You had your backpack event, and of course, you're corralling people in. Everything is happening. You know, you're right in your element. And before long, I look around, and I didn't see my wife. You know, and you know, I'm there with some backpacks doing some other things. And turn around, and I see her in the kitchen with your mom, and she's doing some of the cooking, and my wife is doing some of the dishwashing. So, man, you know, there I was talking, having some fun. You put my wife to work, and I didn't get any crap about it. So that was really pretty good. You know, so the other thing I have to tell you is I'm going to miss some of the commission meetings when you had your hot tea. And, you know, you'd have your hot tea sitting next to me. And of course, it was usually too hot. So you had to cool it off with a little bit of water. And it, yeah, ended up splashing on me, getting over me. And, you know, I guess it'll be a little drier in future meetings when we finally get back together. But no, seriously, you are really a force in the community. You'll continue to be a force in the community. And don't make yourself a stranger. Maybe when Starbucks opens up, we can meet and get that table again and enjoy it. So God bless you.
Thanks, Ed. Appreciate that, those comments. Ms. Bigby, you're up next.
Thank you, Mayor, Commissioners, and Commissioner Simmons.
We can't hear you, Ms. Bigby. Oh, I think her...
My unmute didn't work. Thank you, Mayor.
There we go.
Commissioners and Commissioner Simmons. I'm really going to miss you. I really appreciate the short time that we had to work together. So I was chatting with my team about the things that we love about you most, and we love that you ask questions and deep questions about all processes in the city, not just projects that you're working on. And then you expect transparency from management. So we really love that you ask more details for facts and figures, and you want to make sure that it's understandable for the general public. We just think that that's fantastic. So I'm really going to miss you, and I think you would be a fantastic professional auditor.
I'm absolutely sure that was meant as a compliment. All right, Lee, you're up next.
Thank you. So Commissioner Simmons, I was thinking of one word that would probably summarize how you have sort of formulated yourself in my mind, and that is passion. Like you've got this passion for service to our neighbors, to really, represent them and to make them feel that there's somebody on their side for everything. And it's not just the projects that you were working on, it was actually the activities. So I remember on Saturdays, over at the COVID testing site over at MLK, you weren't there just watching, you were there doing, right? Clipboard in hand, making sure the traffic was working the way it was supposed to be working, making sure people were getting tested. So it wasn't more of just having the idea. It was really having the passion to make it come to fruition and not taking no for an answer. We've had lots of discussions where I tried to say no, right? But your persistence on that was pretty strong. That there's got to be a way. Let's figure out a way, and always there to support those crazy ideas if it was just going to help us try to get to the end. And so, to me, that just demonstrates the passion. I don't have a lot of stories because COVID was pretty much our entire time together. But you did take me up on the windshield tours of the district several times, and I usually like to be the one driving. And I have to tell you, when you're driving, I was like really, really scared. It was a good thing. It was a very large vehicle.
Yeah.
There was some safety, but keep with the big vehicles.
Yeah.
I think you've left a legacy not only for District 1 but for the city. And as Ed said, we know you're going to still remain active. You still have me on speed dial. I know that phone is still going to go off, and I'm not going to be afraid to use it. I did want to leave you though with one quote that I think sort of summarizes the whole Commissioner G.G. Simmons to me, and this is a quote from Leonardo da Vinci. He said, "It had long come to my attention that people of accomplishment rarely sat back and let things happen to them. They went out and happened to things." So, Commissioner, thank you for your service and look forward to a long relationship.
Thank you, Lee.
Thanks, Lee. Ms. Marshall, you want to go next?
Sure. So Commissioner Simmons, the first time that I actually met you was during my interview process back in October 2018. And I remember telling you in your office during my interview that I really admired your passion, because just you speaking to me through the interview process about your district and some of the concerns that you had about things that were happening here within the city of Gainesville, you could clearly tell just from that small length of time that we spoke that you were so passionate about your community. And that was one of the things that I literally walked into the door admiring you about so much, because you can just feel the passion when you speak about, the community, the people, the staff. So that is something that I truly appreciate about you. I think I told you the other week that I'm truly going to miss working with you. I don't say that lightly. You always think about our office when it comes to community events, whether it's COVID testing or, the job fairs that we've done. You've always looked to our office, and we've always been so happy to get out into the community and work with you. And so I'm not going to take up much time, but I do just want you to know that you are truly going to be missed. But as we said earlier, as we spoke yesterday, I know that you're not going far, and that I will see you on the other side in a different capacity, but I'm still looking forward to working with you now, I guess, as a community member.
Thank you, Tanisha.
Thanks, Tanisha. Michelle, you want to go next?
Thank you, Mayor. Commissioner Simmons, I just want to thank you for your years of service on the commission. It was always a pleasure working with you, and I certainly wish you all the best in your future endeavors.
Thank you, Nicole.
All right, thanks, Nicole. Ed, you want another bite of the apple, I see there.
Yeah, I'm sorry. When Lee mentioned about her driving, I had heard stories about Commissioner Simmons driving, and I used to work with a guy, and they said when you got in the car with him, he didn't drive the car, he aimed it, and so that's what I heard about Commissioner Simmons. So keep aiming that car, Commissioner Simmons.
Oh, I haven't heard these stories. I don't know. They might be making them up. Would any yeah, go ahead, Marie.
I hate to interrupt. I don't think I'm able to raise my hand as the meeting host, but I do have a few words, if you wouldn't mind, to share on Omi's behalf since she's not able to be here.
Yeah, of course.
If you will bear with me. So I'll do my best to deliver these words from the clerk. So Commissioner Simmons, our staff has had the privilege of working closely with you over the last 3 years, and we can remember how focused and driven you were when you first came on board. And you've held that tenacity throughout your tenure. There are phrases we could expect to hear from you each meeting, like, let's do great work, or break that down for me, like I'm a 5th grader. We came to count on you to remain focused on the community and to always make sure that we didn't get too wrapped up in all of our acronyms and we didn't leave anyone out. One thing we happily accomplished was finally graduating you from those big paper binders. That was hard work, but we will certainly miss your presence in the office, and we know your work in the community is far from over. And in your own words, let's continue to do great work. Yeah. Even though this is a small part of the journey that may be over for now, we know that your work and impact will carry on. And certainly we wish you all the best in your future endeavors from Omi and myself and our entire staff in the clerk's office.
Thank you.
Oh, thank you, Marie. Okay, we'll now ask any other members of staff if they want to say any words, and we'll start with Ms. Bowie.
Thank you very much. I'll be brief because we were exchanging some niceties earlier in the afternoon, but I wanted to just take a personal point and thank you, Commissioner, very publicly, because I don't know that that people really know how involved you were behind the scenes whenever there were significant community challenges. You were never shy about picking up the phone and calling and saying, I've arranged a meeting, 50 million people are going to be there, and I've got a place for you right at the front so that you can help to solve these problems. And I don't think that's a minor thing. You were never afraid to jump right into the middle of it and really demonstrate through action that leadership is an action word. And I want to thank you for that. They were tough experiences, and they weren't easy community conversations, but I always knew that if you were involved in it, we were going to have an authentic opportunity to address a problem. So there's a saying that says that a strong woman looks a challenge directly in the eye and gives it a wink. And you do that very well. So I won't say goodbye because I'm sure that you will continue to call and on speed dial about a meeting that I need to attend. I wish you well.
Thank you, Deborah.
Thanks, Deborah. Anybody else from staff? Yeah, Andrew, go ahead.
Thank you, Mr. Mayor. I don't usually do this, but it's a little bit unusual for me. But I did want to use this opportunity. I probably have the unique honor of being able to work with Commissioner Simmons in a number of capacities. I've been to Commissioner Simmons' house. She probably doesn't remember this, but way back when I was an intern at the city in neighborhood planning, I followed John Wattell in tow to a Porter's neighborhood meeting. And for me as an impressionable young planner, it really helped open my eyes to the possibility of doing neighborhood planning, of working collaboratively with passionate community members. And I was just really kind of blown away by you, Commissioner, long before you were a commissioner. Then I had the opportunity to work with you on a staff level when you worked in the department with me. So staff to staff, I had that interaction and ability to kind of work together. So that was a awesome opportunity. We started talking about things like the narrative, and then when you became a commissioner, we got to work on that together, and that was also really formative for me. One of my favorite experiences working for the city was coming into the Porter's Community Center and seeing the paper city that was built by all of the kids, and hearing like their stories and having them describe different parts of how they had planned the neighborhood. And what really warmed my heart was hearing one of them complain, who was on the permitting side, complaining about, well, they didn't even get permits. They were just, putting up these things. And that was great. But I wanted to thank you for your service, for always being really thoughtful and asking really good questions, and for thinking of us in this last year in terms of neighborhood enhancement, and just for all your advocacy. And as everybody said, I'm looking forward to working with you in your next capacity. So thank you.
Thank you, Andrew.
Thanks, Andrew. Phil, you're up next.
Simmons, you and I have worked together a long time, going back to my public works days and your days in the Porter's community, and you've always been a huge advocate for your neighborhood before you were elected a commissioner. But I have to follow up on one thing that Ed and Lee said. I understand something now. I've ridden with you before. Now I know why Lee won't ride with me. But anyway, thank you for your service, and I know that you will be out advocating for the Porter's neighborhood, and I know you'll be reaching out to myself and the rest of the Public Works team for something in the near future. So you've got me on speed dial. Thank you and good luck.
Thank you, Phil.
Thanks, Phil.
Oh, by the way, we do have to do another fishing trip.
Oh, count me in.
For those of you on the commission that don't know, she's an avid fisherman, and we ran into her and her mother one day in Palatka as we were on one of our expeditions.
Yeah.
All right, Fred, you are up.
Commissioner Simmons, I just want to say thank you. You've been a friend, you are a colleague, and you were a commissioner, and everything you've done, it's about helping people. And this is why we're in this business, to help people. And I thank you for that passion that you have for helping people. I know you won't go away. And I know when you give me that wink and I lean to the eye that hey, man, you gotta talk and listen to you and where you're going. And I just want to say thank you. It is not the end of the journey, but a beginning of another journey for you. I just want to say thank you for all what you've done for our community and our residents of the city. Thank you so much.
Thank you, Fred.
Thanks, Fred. Okay, let's now go to any members of the public that would like to say some words about Commissioner Simmons. We'll start with anybody here in the chamber. Mr. Shepherd, go ahead. And I'm not going to put you on the clock, sir, but, make the words good.
I do. I'm Don Shepherd, and I'm a people's representative, and so is she. Ms. Simmons has been a great neighborhood and city and county representative. She has showed people what life is about and what being a neighbor to somebody is about. She showed that through Porter and every neighborhood or every business she's touched. I just started campaigning, and I'll tell you, to see the pictures of you out there in these businesses touch my heart, because here is our East Side District 1 City Commissioner who represents us and has done an excellent job of it. And so I wanted to take this time, and I thank you, Mayor Pohl, for giving me the opportunity to take and thank you for being a great commissioner.
Thank you, Mr. Shepherd.
Thanks, Donald. It's hard with math, but is that Mr. Kane? Yes. All right. Would you like to say any words about Commissioner Simmons? We don't have another public comment period. I'm afraid you missed it.
Can I do public comment now?
Well, you can speak to Commissioner Simmons.
It's okay, I was waiting on public comment.
Okay. It was earlier in the evening. Larry, or I'm sorry, Adam, do we have anybody on the phone lines that would like to make any comments about Commissioner Simmons' service?
We do, Mr. Mayor, but I just want to say on behalf of Dr. Schooler and Bethany Taylor and the rest of our team, thank you, Commissioner Simmons, for your service. We watch and we see you have exemplified the best of commitment and engagement and representation in local government. With that, let me turn to a few of our speakers who have called in. First is Ms. Yvette Carter. Ms. Carter.
Good evening, Mayor and Commissioners. It is my honor on behalf of the Office of Inclusion to call and just bid a gracious, most thankful, appreciative farewell to Commissioner Simmons. I almost hung up because Ed stole my thunder with one of the comments, and Tanisha backed it up, and then Fred said some stuff, and then so did Deborah. So I concur with all that has been said about you. Except for the driving part, I think you drive just fine. But just know that our office has greatly appreciated working with you in all of the community endeavors that you've had over the years as a commissioner, and working with you prior to that. We have a long-standing relationship with you for not only Porter's neighborhood, but for East Gainesville in general. I don't know that people know that because you are so well known for the work that you've done in Porter's, but you have been a long-standing advocate for the eastern part of the city for quite some time. So I want to say thank you. I want you to know that I believe that the city is better because you've sat in that seat, and I think that you will be more impactful than you have been, even though that's hard to do, now that you have sat in the seat when you go back to probably your favorite role of being a straight up grassroots community advocate. There's so much that I can say to you, but I won't say it in public. I'll say it in private because we don't want the world to know all of our secrets. But what I will say is that I truly, truly, truly appreciate how you don't believe your own hype. You are just a person for the people. I appreciate that about you, and I try to exemplify that as well. But know that your hype is well-deserved, and that we are going to miss you in that seat, but not in advocating for our community. So I won't say farewell personally because I know that we will be in this fight together for a long time. Thank you, Commissioner.
Thank you, Yvette.
The next speaker is Ms. Katera Acevedo. Ms. Acevedo.
Greetings, Mr. Mayor, City Commissioners, Commissioner Simmons. My name is Katura Bailey Acevedo, and on behalf of the Sisters of Zeta Phi Beta Sorority Incorporated, Delta Sigma Zeta chapter, fondly known around town as the Gainesville Zetas, Sabrina Ellis Williams, our chapter president, we just want to say thank you like never before for your incredible service during your term, and more specifically for the way that you engaged our organization and gave us many service opportunities to help our neighbors, to help our beloved city, especially your leadership during the pandemic, during the initial outbreak, when so many of our service opportunities were limited. You are the public servant who called us and said, come and help, we have this project. And so you gave us an opportunity to fulfill our founding principle of service. You gave us an opportunity to safely assist, and you don't know how fulfilling it is for our sisterhood, especially at a time where we were a little stagnated because we had limits as far as what we could do, but you provided us with safe service opportunities, and that means so much. We look at you as, a colleague in this, I don't want to say fight, but in this lifelong dedication to serving our people of the city of Gainesville and Rochester County area. And in that, just know you always have our lives in royal blue and white. So you continue to do what you have done, and that's call us, be on the ground, boots on the ground in service, and know that you have many sisters here who will answer the call, just raise that finger, just pick up that phone.
congratulations on a wonderful term, and we look forward to what you do next, ma'am.
Thank you so much.
Thank you, Ms. Acevedo. Our next caller is Helen Harris. Ms. Harris.
Good evening, Mayor and members of the City Commission. I had not planned on calling in, but I would be remiss for not doing so. So I'm calling on behalf of Housing and Community Development, and I just want to publicly acknowledge the years of working with Commissioner Simmons over the last 3 years, working with her as a commissioner, and prior to that, just knowing her personally. And I just want to let you know how much I've appreciated working with you, and I'm really going to miss working with you as a commissioner. I look forward to rebuilding our friendship as we've communicated that previously. You've done such a wonderful, wonderful work, and I just want to publicly acknowledge the work that you've done. You are my commissioner because I do live in District 1, and I just want to publicly acknowledge the work that you've done and let you know that I'm truly going to miss you as our commissioner, and let you know that Housing and Community Development really appreciate you and the work that you've done, the work that you've done on AHAC. We did say some words for you on Tuesday, at our meeting, and you definitely will be missed on AHAC. We just want to let you know that we appreciate you and we'll miss you and look forward to what is to come, because we know that you're going to do some great things in the future. Thank you.
Thank you, Helen.
And for the moment, we have one more caller, caller ending in 4066. Some parting words for Commissioner Simmons, please.
Yes, Sister Gigi, this is your girlfriend, Reverend Grinder. Yeah, my voice, I'm a little hoarse, but I really want to call in as your longtime friend to express my appreciation for your public service, and to say that the end of your term as commissioner is not the end of your story, that there will be much more, and look forward to working with you in another capacity. And may God bless you as you move ahead onto many, what I know will be great and productive endeavors.
Thank you, sir. Thank you. Commissioner Simmons, Mayor Poe, that was our last caller.
Okay, thank you, Adam. So now we will turn to members of the commission, and we will start with Commissioner Santos.
Thank you, Mayor. Commissioner Simmons, it really has been an honor to serve with you these past 3 years. And before that, too, I mean, we served together on the Downtown Advisory Board, and I truly do think that we'll probably serve on a board sometime in the future at some other time, too. I'm pretty certain of that. The city of Gainesville and District 1 are a better place from you, not just for what you've done these past 3 years on the commission, but what you've done previously, and it shows. And I drive around, I look around, I see like, oh, that's something that Commissioner Simmons did. That's something better. And that just brings a smile to my face. But really, it's like, as I said earlier, I mean, your passion and you taking action, no matter what it was, broadband, health, public safety, parks, COVID, shopping carts. I appreciate that because I don't see the shopping carts anymore, and they drove me so mad. But you took action. You got it done. That's not a feat that all commissioners can do, and you did it, and things got done better for that. I appreciate that. I'm gonna miss my office neighbor. I've missed this past year. I haven't seen you. When I walk past you, we start giggling. I don't know what it is, but we do. Yeah, our jokes and laughs, and you making fun of my messy office, and though you really can't say much because your mailbox was always overflowing. I walked past it and it was like, oh yeah. But thank you for being my friend. Thank you for your service. Thank you. Your lifetime of service to the city is a better place, and I know this won't be the end. I know you're going to keep working, and I'm right there with you. You've got my number. Call me. Let's get it done. Thank you, Mayor.
Thank you.
Thank you, Commissioner. Up next, we have Commissioner Sacco.
Thank you, Mr. Mayor. Commissioner Simmons, so when I have to think of a quintessential memory of our, sadly, 1 year together, just official 1 year, I think Gigi's the one who taught me how to push the button, because all of them let me get up here and no one told me how to be, actually do my job. And you reached over and said, do you know what you're doing? I'm like, so thank you, because otherwise I wouldn't be able to do my job. Thanks for nothing, the rest of you. But even before I got up here, I can remember the first time I had a real interaction with you, and it was in Porter's. And it was a backpack drive, and I was there as an attorney giving out pamphlets about our services and information, and I saw the people part like the Red Sea. And I went, oh, it's Gigi. People parted for a natural leader. They respected you. Where you walk, people move. And I said, wow, I'd like to be like that when I grow up. And then a few months later, you were, I can't remember if you volunteered or were assigned, but you were on the rental subcommittee. And it was wonderful to have, no offense, a level-headed but passionate advocate who listened, who questioned, but weighed on the matters and the opinions of the public. And that was just a wonderful experience to have with government. And I think I often cite that committee as why I decided to run. So I think having you there as an example of what women can do, that it's okay to raise your voice, it's okay to tell the others to hush, it's okay to disagree with what's going forward. And I learned a lot of that from watching you. I'm gonna miss you. I'm gonna miss having my buddy. Having another lady here with this mess of testosterone over here. But I'm looking at this one silver lining. That now I can call you and ask you your opinion on things. And we don't have to be recorded or filmed or have the public there. So I look forward to, in the next few weeks where I could just be like, hi, Gigi, what's your honest opinion on this? And we don't have to watch our words. But I know it's not going to be the end of your service. I look forward to asking you questions and opinions and helping you in any project you want to move forward. So
thank you.
Thank you.
Thanks, Commissioner. Up next, we have Commissioner Ward.
Thank you, Mr. Mayor. This is never fun, but I'm gonna try to make it fun. I couldn't figure out where to start, so it came to me that I should start at the start. I used to tell everybody that county commissioner, the difference between city and the county commissioners is county commissioners drove trucks and city commissioners drove cars. And I drove up here to Gigi's first meeting, and there's a great big white truck. And I thought, what is this? Somebody must have parked wrong. Because city commissioners drive cars. And now we just drive all kinds of things. You never know who's going to be parking here now. But that was kind of emblematic. Gigi makes a statement with when she shows up and all the way through. And I don't know if y'all know this. You watch it at home. I don't know if you know this about Commissioner Simmons, but she doesn't have time to play with you. She's straight up with her words. We after not being able to meet for a while, we came back in and started meeting like this with these crazy things and all that. And we're standing out here in the offices talking beforehand. And I was wearing this Florida tie, and she pointed over and said, "I like your little Florida tie." I said, "Thank you." And I started telling a story about it. I said, "No. I like your tie. I like your tie." And I remember, all right, Mom's in the house. It's okay. And I'm gonna miss that. On the dais, Gigi, you have been the epitome of the maxim that it's not about the last vote, it's about the next vote. And that's the most important thing there is up here, to me. We don't have to agree. We have to know that we're working to make Gainesville a better place for the people that live here. And there is no question that that's been your driving concern as a commissioner, is making this a better place for the people that live in this place. On the Digital Access Committee, that started out as just talking about broadband and trying to figure out how to make that happen. You wanted to join that committee to talk about other kinds of digital access, about how we could stretch into providing access to the digital world for after school, for community centers, and how we could make that happen in a way that's different than just running broadband to people's houses and apartments. And because of that, because of what was there and what you brought to it, that committee has become a very different thing that can have a tremendous impact, and is going to have a tremendous impact because of what you brought to it on the people of this community for a very long time to come. I do this thing where when I get an idea, I start writing up pages and pages of a proposal and the PowerPoint and all this stuff. And while I'm doing that, Commissioner Simmons is out there finding somebody to give turkeys away so people get fed, and organizing COVID testing sites, and reminding people where they can get shots for COVID and get vaccinated. Commissioner, there is no question in my mind, and there should be no question in yours, that people in our community are able to there's a child somewhere in our community who has had a better educational experience because of you. There is a family who got fed and had a nice Thanksgiving because of you. There is someone in our community who's been vaccinated against COVID and whose life is safe because of your work. And that means so much. And you should walk away from this knowing that you have made a tremendous positive impact on this community. And I am proud to call you my friend, and I am better for having worked with you for these last 3 years. Thank you.
Commissioner Ariola.
Gigi, I had a hard time figuring out what I was going to say, so I wrote it down. So I could get through it. But I am going to smile through it because I have only good memories of serving with you. And there's so much that I'm going to miss about serving with you on this dais. This dais, for people who've been up here, know that it can be a very lonely place. But this commission in particular, even though we've probably got more 4-3 votes than any commission that I can possibly recall, and it's a mix too. It's a mix of 4-3. Anybody is the swing vote up here. Yeah. And I still just have nothing but positive memories. So I do want to share one public secret. I know the real reason why you're sitting on that end. And that's because that's the only way she could ever see past my hair.
Yep.
There was about a year there where, because I always sit up like this, and there was about a year there where Gigi would always just be, and it was always with increasing more agitation every time, just sit back, just poking me. So I started getting a haircut. But COVID changed all that, and so Gigi just got straight to it and moved over there. And honestly, I know you got the mask on right now, but that smile always made me feel better about coming into work. You brought a consistent attitude to the dais that I have always appreciated. Many times your position on an issue was so firm because you know exactly how you wanted to vote, but you were always open to listening to.
Get out of here.
You always knew when time was up. You were always open to listening to even the tiniest argument, even the tiniest argument you would listen to. And that consistent attitude, that has been my first impression. I remember in the first campaign, I called you, and I was calling to give you words of affirmation and words of advice, and you ended up flipping the tables on me and blowing me away. And I just remember thinking, wow, this is going to be a great commissioner. And you have been a great commissioner. You have set an example for city commissioners that is difficult to emulate. I would like to think all the times you seconded my motions is because I make good motions. But the reality is you seconded a lot of our motions, and that was when you weren't making your own. And of course, sometimes your consistency came with serious opposition to motions that you did not support. And all of this sounds like normal practice for commissioners. But after serving many years, I've learned that this kind of consistent collaborative approach to legislating is very rare. Now, this isn't to say that you didn't come in like like you had a motion in mind sometimes, but we all had to work really hard to get your vote. Really hard. In deliberations, you know, when the commissioner talks about coming up with ideas and bringing it, you know, we all try to think, you know, what does Commissioner so-and-so think of this? You know, how can I convince Commissioner so-and-so to vote for my initiative? And we had to work hard for your vote. And it was always there to earn. And I appreciate that so much. So what I'm going to remember most, besides my favorite phrase of yours, was always, say it to me like I'm in the 3rd grade. I loved it because so many times we don't slow it down. This place is so fast. These presentations are so fast. The years go by so fast. You've got to slow it down. What I'm going to remember most is your commitment to being true to yourself and asking difficult questions. We did serve on a lot of subcommittees, and we got to do a lot of good work, not just for District 1, but for the city as a whole. And because of that, I got to know your priorities and interests a lot better over the years through each subcommittee. And I felt that made all of us work better as a commission, and I felt that that's left our community in a better place. And as a chair of one of those subcommittees, I really appreciated Commissioner Simmons' style of being commissioned, because I could always tell when it was time to call on her, because she was about to make the point or the question that was going to help get us to the next step, get us past that hurdle. And that always happened in the rental housing subcommittee. When that room was packed, I always knew when it was time to go to Commissioner Simmons. And I really appreciated that a lot, Gigi. And this past year has made us, the 7 of us, the eternal commission because of what this city went through. And you being there, Gigi, and the commitment you had to saving lives in your district was so real. And really, I will, whatever happens for the rest of my life, I will always remember this city commission, the 7 of us, and I will always, always remember you, Gigi Simmons. I will take the lessons you taught me, your example, your personality, your leadership. I'll take it with me everywhere I go. And I am very much looking forward to our conversations off this dais. But I want to congratulate you on an exemplary 3 years of service that has set a new standard for District 1.
Thank you.
And thank you, Commissioner. Commissioner Johnson.
Thank you, Mayor.
So Commissioner Simmons, and I'm going to call you Commissioner Simmons from the rest of the time that I see you, because you've absolutely earned that. Some of my favorite memories of you and I were actually when we were on the campaign trail, and I felt like I really got a true glimpse into Commissioner Gigi Simmons, or Gigi Simmons at that point, and I understood the passion that you have for D1 and the commitment. Like, that word passion just keeps on coming up, because that's what you truly embodied. You have passion for D1, and I remember thinking to myself, how we together we really accomplished something historic. Together we were the Black women on the commission, in history. And that's something special, and that's something that I'm always going to remember about us. And Gigi, I mean, even though it was an intense experience running for office together, you made it fun. You made it so much fun, and I had a blast on the campaign trail with you. Something that I will always appreciate about you and what you bring to this job is how incredibly grounded you are. Like, you are true, you are authentic, 100% all the time, and we can always expect you to show up that way. And that's what I will always appreciate about you. And even though at times we have approached our advocacy in different ways, I appreciate that you bring heart to this, you bring passion, and I'm always going to remember that, and about the way that you have always approached this job, and something that I wish to embody that you bring to this. And I will always respect and appreciate all the work that you've done, because I know it is not easy. And I know the different kinds of struggles that are there for us. So I wish you all the best going forward. I know that you are not going anywhere, and I look forward to working with you. And you know what? I don't know if I can do this really well, but one of my favorite phrases from you is, I knew, like, you would get silent, right? It'd be like, explain this to me like a third grader. And I was like, yes, we know it's coming. We know it's coming, Gigi. So that is one of my favorite phrases. And I consistently think about, okay, you know what? I need somebody to break this down to me. I'm going to ask them to explain it to me like a third grader, like Commissioner Gigi Simmons. Thank you for all that you've done. I appreciate you, and all the best.
Thank you, Gail.
Thank you, everybody. So, Gigi, of course, we knew each other before you were a commissioner, like you've known most of these people, because you're out there and you're doing it. You're such an incredible example and inspiration for so many people in this community. You show up every day and live your life and present yourself as you are. I know that you had challenges in your life. You had real struggles. And you had struggles that a lot of people have, and that the struggles get the better of them. But that's not the path you chose. You chose a powerful path. And I admire you so much for that, because it has sculpted you into this phenomenal woman, leader, and community advocate. It's impossible for me to imagine, particularly Porters, without Gigi Simmons. I mean, you've literally spent your entire life building up that community and being an advocate and manifesting your pride into making your neighborhood the best that it can be. And then, of course, that spilled out into the rest of our city through all of your other work, whether it's CRA advisory boards or working for the city at parks or at planning or all the other contributions you made. But you set an example, and that's more powerful than anything. And when people see a leader setting the example and living the values, then they know that's how it's supposed to be done. That's how I want to be. And ever since I've known you, that's the Gigi Simmons I've known. But it all came together when I had the honor of teaching those two boys. Oh my goodness, y'all. These two boys. I had them in the same two classes, both of them. They couldn't be more different, but they are both your sons, 100. And of course, they knew who I was because they were raised by a mama who makes sure they know what's going on in their city. I didn't know who they were at first, right? So when I found out, I said, oh, I'm teaching Gigi Simmons' sons. I better pick up my game. I mean it. I started being nervous. I said, I gotta pick it up a notch. Getting to know them, and I mean, we had a just phenomenal 2 semesters together. It told me everything I needed to know about you, because, you know, if anybody needs to hire somebody, if anybody's looking for a boyfriend, I don't care. If you need a good man, I know 2, and they were raised by you, and to me, that everything else in your life is awesome, but what you have been able to do in raising those 2 boys, men, can't even believe it, young men, says everything that anybody needs to know about you. I've never served with anybody at any level that's more of a citizen servant. You didn't do this for any other reason except you wanted to be in a position to make your community better, make our community better. There's a lot of cynicism towards politics and elected officials, and some of it's deserved, a lot of it's not. But nobody could ever say about you, you were doing this for any ulterior motive, as any sort of stepping stone. You only, and I'm sure you thought long and hard about where do I need to be to have the greatest effect on our community? And at this point in your life, it was this job. And that's the only reason you did it. And I admire and respect that so much, and hope that all of the folks that get to serve with a city commissioner in the future are able to serve with somebody that approached the job with the mentality and ethic that you do. It really was an honor. It's funny that Commissioner Ward talked about, it's not about the last vote, but the next vote. I wrote that down too, Commissioner. That's how true it is. And that's not always the case. In fact, it very often is not. And I first learned that from Commissioner Jennings, Sr. He used to say that all the time. And it's really one of the most valuable lessons you can learn in governance. But it's hard. It's hard that when a vote doesn't go your way, you don't take it personally and kind of let it linger with you and make it affect, you know, the future work that you have to do. And look, Gigi, I know I annoyed you and got under your skin and got on your nerves from time to time. And I know that because, as Commissioner Johnson said, you're authentic. But it absolutely, this is how unusual it is. It just absolutely floored me that it wasn't even about the next meeting, but the very next issue, after there would be tension, you moved on. And whether it went your way or didn't go your way, you said your piece, you shared your annoyance, but you were on to the next issue. And that allowed me the comfort to know, at least with you, I could be authentic. And I could communicate to you what I believed and why I believed it and why I thought a certain way. And even if that got on your nerves, it was okay, because the next issue, we were back starting at the beginning. And again, that's rare, and I appreciate that, and it helped me be a better mayor. It helped this commission make better decisions. Absolutely no question about it. We're gonna miss you. You know, it's you know, David's right. Having been through the pandemic together, there was no way to prepare for that. As a governing body, we did our best. We're still doing our best. But the way that you reimagined your position almost immediately over the last 12 months, 13 months, has been nothing short of miraculous. You know, for a lot of folks, they don't understand how difficult this job is, and there's really three main components. You know, there's the constituent service, the getting out and helping neighbors part. There's the policy part, which is incredibly challenging, and then you've got to get to know an incredibly complex organization. You know, incredibly complex, and at least have a basic competency in all of it. And you threw yourself into that citizen servant role, that how can I help my neighbors? And Harvey's right, you saved people's lives. People are alive today that wouldn't have been because of what you did over the last 13 months. There's no greater honor than to be in that position. And so I'm just so proud of you. It has been such an incredible honor of mine. I've served with a lot of good people. But you absolutely are first among equals. You have been everything our city could ever want in a city commissioner. And I need you to know that from me. Now, what's next is a beautiful thing. Let me tell you, nobody else up here knows what it's like to lose an election. It ain't bad. I'm gonna tell you, it ain't bad. It happened to me. It ain't bad. You're gonna sleep better. The sky's gonna be a little bluer. The birds are gonna sing a little sweeter. I'm telling you, like Raina said, you're gonna be able to have conversations about all the stuff you always wanted to talk to us about but couldn't. But you are going to be able to do incredible work. And I know that's who you are and what you'll do. There's so many folks, but I think of a couple folks that I served with that I really admire and respect, who have probably had a greater impact since they lost an election than when they're on the commission. I think of Susan Botcher, I think of Craig Carter. They're out there and doing great work, and the thing about it, they get to choose the things that they're going to sink themselves into. When you're on this dais, guess what? Everything is your business. Every issue is your issue. You don't get to pick and choose what you care about. It's everything. And so I hope you embrace that next part of your journey, because you're made for it. The experience you've gained in the last 3 years will be invaluable. We need you. We absolutely need you for the work that's ahead. You know how ambitious what we've set out to do is, and the 7 of us or the 2,200 of us inside this organization can't do it alone. We need you and other folks that are willing to do the hard work out there in the community. And so I know you're not shy about calling people and telling them what you need. I'm not going to be shy either. So you just expect to get a call. And I want to tell one last story because I think it really just gets to just what a kind heart you have. It was a couple weeks, I don't know, maybe early days of COVID, the timeline was very distorted. But it was probably 7-10 days into past March 16th, when everything sort of went quiet. And so I called all the commissioners just to check in on them. just to see how they're doing, if I could do anything for them. And I left a very long, very sincere message on somebody's voicemail. On somebody's voicemail. Apparently it wasn't yours. Because the next day I get a call from Gigi asking how I'm doing. That's who she is. She's I haven't heard from you, and I wanted to check in and see if you're doing all right, and what do you need? And I said, well, that's nice, Gigi, but did you get my message? She said, what message? I said, okay, well, some total random stranger got this long rambling message that probably made no sense. But that really meant a lot to me, I gotta say, Gigi, because honestly, I didn't get many calls like that. I could count them on less than one hand. And so to know that you were thinking about me at that time, and you're not as a workmate or colleague, but just as a friend, it made a big difference, and it really helped me at that very difficult point in time. So for everything you've done, thank you. We've got this, maybe material goods are not always the greatest symbol of our thanks and gratitude, but you're going to get one anyway. And it's just a very nice plaque I'll bring down to you with the city seal on it, and it says Commissioner Simmons and your term of service, and we can show everybody out there. But we just wanted you to have something to remember this time and remember this motley crew that you served with and helped so much. So thank you, Commissioner. And the floor, my friend, is now yours.
Well, first of all, I gotta thank my Lord and Savior, Jesus Christ, for giving me this opportunity to serve. I know He doesn't make any mistakes. I was put here for a reason, and I was put here to do a job. Before I go there, I would like to thank all of my charter officers, all the people that called in and just showed me so much love, all of my family and friends that have stood by me these past 3 years as I served as your city commissioner, my wonderful boys, my mother, my beautiful, beautiful mother, my deceased sister, and family members and friends that I've lost throughout this whole process. This was an extremely challenging 3 years for me, personally. I lost several loved ones throughout this process, but I knew I made a commitment to my community to serve them. And that's what I did. Under the circumstances, the tragedies that I was faced with in my personal life, I served my community. And I did that because I made a promise. I made an oath. I put my hand on the Bible and I promised to serve. It didn't say when tragedy strikes, you don't serve. It didn't say when there's obstacles in your path, you don't serve. I made a commitment to serve. And I did that. And I remember walking in the back, Lauren, and you and I crossed paths, and I was really going through personal tragedy. And you asked me, how are you doing? And I said, Lauren, I'll never be the same. I'll never be the same. Because of those experiences that I had personally, it fueled me. I utilized that hurt and that pain to focus on the bigger picture at hand, and that's serving my community. I know that I did the very best that I could do under the circumstances. I never gave up. I showed up to work, and I worked. And I have to thank my mother for that, because I was raised by a strong single mother that taught me the value of hard work, that taught me the value of what you say you're going to do, you do. A mother that loved me unconditionally. A mother that showed me, not only showed me, but she instilled in me goodwill and good work. And because of her and her love for me, I was able to serve my community. I always believe in doing and not talking. And that's how I raised my sons. I raised exceptional young men. Exceptional young men. I believe that there's a time for everything. There's a season for everything. And you're only put on this earth for a short period of time, and you make the best of it. You make the best of it. And that's what I've done. I've been committed to my community for over a decade. I've worked hard in my community because I love my community. And I understand what it's like to not have. I understand what it's like to struggle. I understand what it's like to be in an environment that's not healthy, that's not safe, that's not good. I've been there. I lived it. And guess what? I overcame it. I was born and raised next to a pool hall between an alleyway. I left the pool hall and now I'm sitting in City Hall. And I'm gonna say that again. I was born and raised next to a pool hall between an alleyway. I left the pool hall, now I'm sitting in City Hall. You could do anything if you put your mind to it. Nothing is easy. Nothing is given. It's earned. And I was able to make it out of my situation, become an inspiration, and give back to my community. I have to thank my mentor, Dr. Portia Taylor. She's been with me on this journey for over 20 years. She's been beside me. She's watched me. She's helped me. She has shown me, and she's been just an awesome mentor. And so I have to acknowledge her and give her all the thanks and all the love because she has been such a true inspiration. 3 years ago, and I said this when I was sworn in at my swearing in ceremony, I opened up the doors at the Thelma Bolton Center. I was a greeter at the doors at the Thelma Bolton Center to usher in the commissioners to be sworn in. Now here I am, a former commissioner myself. Anything is possible. Anything is possible. We can have a strong, vibrant East Gainesville, a successful East Gainesville, if we work together and continue the good fight together. It's not impossible. We just need to get out of our own way. My situation, my life, is the life of many young Black girls like me. I wanted to be an inspiration. I wanted to show other young girls who feel like they can't accomplish anything or they can't get to another level. They may feel like an outcast. They may feel like they're not being heard. They may just feel like there's no way to go. I wanted to show them that you can do it. And yeah, I don't speak much. I don't talk about a lot of things because I'm focused. I'm driven. And that's what you do when you're focused and you want to make a change and you want to make a difference. You work. This has been an extraordinary journey for me because I can guarantee you people that see me grow up could never imagine I would be sitting in this seat. People didn't have an idea or a clue that a young little Black girl from Porter's could be sitting at the dais in City Hall as a city commissioner. And I did that. So I am a winner. I never lost. I've always been a winner. I will continue to be a winner. This was just a part of my journey. You were absolutely right, Lauren. It gave me a platform. It gave me an opportunity to show other girls, Black girls that look like me, that see me, that listen to me, that when they see or hear the name Gigi Simmons, they know that they can do it and that anything is possible. That's why I'm here. So whoever sits in District 1 City Commissioner seat, you will really have a bar that's been set high. I accomplished what I was supposed to accomplish. I did my job. Now it's time to go. Like Commissioner Johnson said, we made history. A little girl, black girl from Porter's, made history in this city. I have nothing to be sad about. I have nothing to say or wish I could do over. I would do it again if I had an opportunity. I'd do everything the same. This has been a wonderful ride. Just as much as I brought to this dais, you guys have brought a lot to me. We worked extremely hard in these past 3 years. We've done extraordinary things, and of course, some people may not see that, but it'll show eventually. It'll show. We did a lot of hard work, and we did a lot of great work together. I'm going to miss you. I'm going to miss having those conversations and looking at the side of your head. I'm going to miss that. I'm going to miss Ed looking at his socks. I'm going to miss Harvey and calling him, you know, you sounded like my dad today, Harvey. I'm going to miss the girls, everyone's daughters, and asking how they're doing, how Beatrice doing, and yeah, she's a little firecracker. I'm going to miss these conversations. But you have my number. I'm not going anywhere. We started a lot of projects, a lot of things that I will see through, that we're going to finish. I'm very hopeful. I'm very optimistic. I feel the east side of the East Gainesville, Eastern Knoxville County, it's in well position to really flourish. We have some work to do, but we'll get it done. We're going to get it done. But the opportunity that I've had, the journey that I've been on, and the things that I've accomplished, it's mind-boggling to me. But I'm humbled, I'm blessed, and I just want to thank everybody, all my supporters, all the people that wish me well, everyone that stood in my corner, everyone that's been with me, my family, my aunts, and my lovely mother, who I can't say enough about, and especially EJ, my EA. She's been phenomenal. She's been wonderful. The staff, the parks, recreation staff, the planning department. I've had relationships with with everyone for a long time. I just didn't get here in 3 years. I've been here. And so this has been an extraordinary journey again. This has been wonderful. We will always have these wonderful memories. It's been a great experience. We did a great job. We did a great job. I'm just so full of joy right now. I feel great. Again, my journey has been, it's been wonderful. I've come from a place that I can truly say, thank you. Thank you. Thank you for this journey. Thank you for allowing me to get to this place. We all make mistakes. And it's going to be some rough days, but you get up, dust yourself off. You know, David, the football analogy. We on the 10-yard line, the 5-yard line. We almost to the touchdown. Now I have to hand the ball off. You got to keep it moving. We got to keep it moving. Don't nothing stops. We keep it moving. We'll get the touchdown. I got to go to the sideline, but we still got a game to play. We're gonna win. We're gonna win. So this has been wonderful. I just thank you all for allowing me to be a part of this journey with you all. And that goes to my charter officers and all my family and friends in the city of Gainesville, my code enforcement folks. I love you guys. Look on the bright side. You won't have any more binders up here to save some trees. Everybody have a laptop or, you know. So I just, again, thank you all so much. It's been a great journey. I love my family and friends here at the city, my GPD officers, the people that work in the fire department. You guys have been great. Public Works, the Colvin, and people at Depot Park. I mean, just everybody has been phenomenal. It's just been absolutely wonderful and a pleasure to work with. So thank you again, and I'm on to the next chapter of my life. But this has been a complete honor. Thank you so much.
Well, thank you so much for everything you've given to our city. And with that, we stand adjourned.